All right.
I guess I could be a substitute for subcommittee.
Yeah. Okay. We'll take up 353 first. So who do I have here for 353? Raise your hand.
That's not exactly accurate
Okay. Why
because
you're the one who wanted us to have this discussion, right?
I'm sorry, I didn't hear that. John.
You're the one who wanted us to continue discussing it.
Yes.
Okay. So tell us.
Okay. So I was.
Since you're the only one in the room, go for it.
So I've been talking to Gateways, who was here last week. I mean, the last time when we had the thing, and they're having people that have been turned away for insurance coverage for Down syndrome, behavioral therapy kind of things. And the problem that we've been seeing is that a number of Down syndrome kids, and we're not talking about a lot because we only have 20 kids a year born in this state with Downs, that they are not necessarily autistic. And that's the clear code that's in the statutes right now. You need to be Down syndrome with autism in order to get coverage for the behavioral therapy that we're talking about. Except that in talking to the insurance department, we may have an issue that we're not using the right codes, that there may be other codes that are applicable. In other words, you don't have to be Downs and you could be something else. And so I wanted to ask them to come in and talk about, just for a few seconds, what is possible? What kind of an investigation can they look at to find out where the issue might be? Because these folks may be covered and we don't know it. So
Hello, good morning. I'm Michelle Heaton. I'm the Director of Life and Health at the New Hampshire Insurance Department. So, to give a little bit of background on this issue, the insurance department has their consumer services hotline and complaint process, and we receive complaints all the time about a variety of different issues. We work with consumers to resolve the issues when there's regulatory violations and provide them with information, even if it's a plan that we do not regulate. To date, we have not really received any complaints regarding this issue about coverage for kids with Down syndrome and things not being covered. So from that respect, we're not really sure where the breakdown is. So we would encourage anyone who's having problems with coverage, that's commercial insurance coverage, please come to us and file these complaints so we can help them work through the process. As I was talking to Representative Spear, one of the issues is this can be very fact specific. So it depends on, the type of insurance, the type of coverage, making sure that it is commercial plan. What are the symptoms that the child's experiencing? What type of services are they trying to access? Are those services in network? There's a lot of different variables. So without, the individual complaints, it's kind of hard to just put out general information to help people. One of the things we can do, but again, it's a very small population we're talking about here, so I don't know that there's necessarily anything in our claims database, but we could look up some claims information and see kind of if things are being denied and the reasons for those denials. Another issue is that if a child is going to ABA therapy, then the coverage, could depend on how it's being coded to be submitted. So it could be that there are children with Down syndrome getting the ABA therapy, but maybe they're duly diagnosed and it was coded as autism and there's no reference to Down syndrome. So we're not going to necessarily see that in the claims database. So that could be something that you ask us to do, would be to do a study to look at coverage for Down syndrome or coverage for services for children with Down syndrome and at the denial rates and see if we can come up with any reasons. But again, when we're talking about a really small population, we just don't really know. We may have looked at this. I'm not sure. I'd have to go back and look because it's been a while since we were talking about this bill. We may have done some initial work on it, but nothing really stuck out if we did. But we can go back and revisit that and see is there, you know, certain codes that are having a higher denial rate, but there are limits in our data because of the small population here and in the way it's been coded. So it could be being coded in a way that is being covered and it's not going to show up as a denial in our system. So really the best way would be if there are people being denied coverage, file a complaint and we can work through the specifics of that case.
Okay, I have some people that have work with Gateways. If you know who they are, they deal with Down syndrome and autism kids and adults, and I think I can get them to give me some people we can touch base with to find out how they've been denied or whatever, and then you could possibly work through what happened.
Yeah, we'd be happy to do that. And we do that all the time for anytime there's coverage issues, helping providers and consumers work through how do we get coverage for this? Is there coverage? Is this covered? Why or why not?
But at this point, without having a specific belly button, as it were, as we say in the biz, you don't think it's worthwhile to go looking at data just on any kind of thing you could look at it proactively?
Yeah, I mean, we could, but I don't know. I mean, without looking, it's more Jason's territory. But I'm not sure how much data there's going to be there and if it's really going to tell us where the issue is because it's a small population. I think the most efficient way would probably be reaching out to those people,
I'm gonna
sending them
do
our
that.
way and giving us some specifics so that we can look at those specifics and find out what exactly is going on there.
Okay, I will do that. Thank you.
Okay, so that's great. So the only thing, just to educate myself, what is it that we do cover now? I mean, what's in our statute? What's the ways? Is autism treated as a mental health issue or is it treated as a physical?
So for all commercial plans, mental health treatment must be covered. So that covers
So
the
it's treated
gamut
as mental
of
health.
things.
It is treated as mental
Um,
health.
y- Autism is a mental health disorder that there is treatment, and that's where typically ABA therapy is used.
Okay,
when
so
we're
it's in the
talk-
DSM, right?
Yep.
Okay.
And when we're talking about Down syndrome, there are a variety of different treatments depending on the particular issues that the individual is experiencing. So we do also mandate early intervention services for all children. So anytime
Yeah,
there's
so you wanted
developmental
to,
delays,
I vaguely remember that statute.
yeah. So anytime there's
So-
developmental delays, that would cover speech language therapy, occupational therapy, physical therapy, a lot of those issues that also kind of overlap sometimes with autism. So anytime there's developmental
or Down
delays.
syndrome.
Yeah, or Down
moved
syndrome.
over to Down.
So
okay.
it depends on what type of issues the child or individual is experiencing. But for the
Again.
most part, we already have mandates in place, and this would be all part of the essential health
Right.
benefits that are required in the individual and small group.
So as far as you're
market. So-
concerned, in terms of the mandates we've already done, in terms of the mental health, A, and then B, that in terms of early intervention. And
Yes,
just I
that it would
remember
likely
the
fall
early
into one of
intervention that
those.
we've already passed. We already have a mandate already on the statutes.
Yeah, so if there are gaps, we want to work through those because it could be something just not being coded right or it's not being submitted properly. But if there is a misunderstanding maybe with carriers and what they need to cover, we'd be happy to issue additional
Yeah.
guidance to clarify to the extent there's any.
What you just said was very
Misunderstandings.
important. I think if the practitioner doesn't know what all the what the appropriate codes are, they may not be coding it right. So you have the ability to go out and tell them, you know, you're supposed to be using these codes or for these conditions and those kind of things.
Yeah, in the past we've issued bulletins. We've done a couple recently with respect to mental health practitioners and primary care behavioral health model, issuing guidance of, you know, these are generally the types of codes and directing carriers to make sure their providers know the proper codes to use to have those claims covered. because sometimes it can vary too by the insurance carrier, and in their provider contract and manual, it usually specifies how they need to code stuff to have things covered.
So the early intervention statute, do you mind tonight emailing me that RSA just
Sure.
to remind me? Because I think we should put that in the blurb in the committee report, that we should say that this statute does exist, and if it is not being effective for, if some practitioners feel that this is not doing what it's doing, then we need to be brought to our attention, or the department's attention, so we
Yep.
can address it, so that if future legislation would be, if it became clear that statute is somehow not covering these kids.
Yep, I will be happy to do that.
Does
And
that
we'll,
make sense?
we'll all get a
I'll send it to
copy,
both
right?
of you. Yeah.
Well, I'm looking for
Okay,
you,
good.
to write the committee report, okay? And so I'm giving you something to put in that committee
Oh, I'm
report.
writing the report?
Yeah, no, tag you're it.
Okay, then.
Okay, so, but that, and in it, I want you to put in how, that we need the communication to the department on, where there has been a problem with when somebody got a rejection or whatever, they need to communicate that. And but more importantly, that we already have a statute for early intervention.
When we say early intervention, how many years old are we talking about?
I think our specific mandate statute goes from birth until 3 years old, but it would still be covered as part of essential health benefits. So our early intervention statute is part of our benchmark plan and was in place prior to the ACA, but the general EHB requirements would require those services to be covered past 3 years to the extent that they're medically necessary. I think at some point, and it would probably depend on the child, but once they get to a certain age, I think, and I'm not a doctor, so I could be a little off on this, but those interventions are not as successful after a certain age. So I
I
think
had-
that's why back in the day we had put that 3 years, but essential health benefits would have to require beyond that 3 years to the extent it's medically necessary.
You'll write that in an email
Yes.
to help her out.
Yes, I will follow up with an email.
Thanks.
Okay, we good?
Do I use this? You're gonna have to tell me what goes into one of these reports. I've never seen one.
Okay, well, oh, okay. That is true. So basically, the motion's either, recommended or not recommended for future legislation. So we're pretty much uniformly, everything is gonna be not recommended because it is.
Well, I
in the
want to
old
see
days,
what there is first, right?
what you say is that as the bill as written, as it is right now, all right, no, we don't recommend this. What the committee does recommend, what we do feel so strongly in support, is we need better communication from providers who are experiencing refusals from insurance company to communicate with the department. And so that then the department will know whether we need to look at this statute in the future years.
But there was one piece. The one piece where I go and find somebody who has been denied and the insurance department tells me why they were denied.
Good luck finding that person.
I do think I have access
You
to
think
those
you have
people.
right? Okay,
Gateways tells me that they will provide those people.
right.
Yeah,
Well,
and we'd be happy to work through them to make sure coverage is appropriately
Let's see what they
you
come
know,
up
happening.
with. Yeah.
And
right.
to the extent that there's any confusion about what's required, we're happy to follow up with the carriers to make sure they understand what the law is and they're following it. But to the extent, if we find something that is some kind of gap, and off the top of my head, I'm not seeing where that would be. But if we do find that, we'll definitely be coming back to close that loophole with you guys.
So
But-
so what you just volunteered for is that you're going to go find a real life story, and you're going to get it to the department, and then once the department's got it, and once you've dealt with it, then the department can come back in a couple of weeks and tell us Okay, so that it has to happen before October 17th. That you need to. Okay. Okay. Exactly. No, I said put the pedal to the metal, and see what you can get, and that way we'll have a real life anecdotal story on how what's going on.
And if I can't get anybody, then we'll just go with what we said before about the essential health benefits and the early intervention and all the rest of that.
Correct.
Okay.
That make sense? Okay. Thank you very much. I think. All right, we'll move on from 353 to 1571. Okay, so who's here for 1571? Okay. All right. So I see the sponsors here, so why don't you come on up? Yeah. So in the old days, before we had these microphones and cameras, and let's say pre-COVID, when Commerce had subcommittees, we wouldn't be sitting in our seats. We would all be sitting in a corner, and we all be kind of collect together, and it's a conversation, right? People are not testifying. It's a conversation, and it's a back and forth, and try to figure out, where we are, where we should go, what's the right answer here. So, we'll try to treat it like that, but obviously we have microphones, so everybody at home can watch. So you have to turn your microphone on, and okay. So, if I understand this bill correctly, is that anybody can test their blood sugars.
Yes.
And I just, I don't know if you're right. I was just diagnosed with pre-diabetic. I'm 6.4 on my A1C, and so now I went out and bought a fast kit. Which everything was real cheap until they see how much they charge for the tabs. And I said, how do people afford this? And he said, well, most people get their insurance companies to pay for it. But they wouldn't pay it for me because I'm pre-diabetic.
Problem number
So I
one.
got to get my A1C up to 6.5. Then they will pay for those tabs. And boy, the prices are all over the map of these little tabby things. It was the package is 50, and Walmart was even more expensive than who was the pharmacy, Walgreens. They were like $80 and for them, and then I found I can get them from Amazon for 40.
So you did your homework very well, Chairman.
Yeah, that's right.
Yeah.
So I do know the price is up. So the issue now is that that theoretically anybody who's already a diabetic can get test kits for free. Okay, that's what I'm.
Could I
the
respond
insurance
to that?
company. Okay.
So you can get test kits for free if you have insurance coverage,
Right.
and it is recommended that you do that. I wouldn't say everybody's getting a test kit.
No,
for
I'm
free.
saying people could. Right. And then obviously this summer I talked to people, and I'm amazed the amount of people who first start testing really religiously, and then after a while they decline in their testing themselves.
And we know that that is a very common circumstance, that when people are first diagnosed with diabetes, they're generally quite concerned and probably scared. And compliance with recommended testing is pretty good. And then over time, people do it less. And one of the reasons people do it less is it's not particularly comfortable to finger stick over and over. It's a small finger stick. It literally is less than a pinprick in a way.
It is a pinprick.
But your fingers do get more sensitive over time, and depending on how much information is beneficial to that patient and how inconsistent their blood sugars are, the more inconsistent their blood sugars are, the more frequently they should check to help inform how they're managing their diabetes. And depending on what type of diabetes you have and how it's treated, it might be recommended, I'm not exaggerating, to test your blood sugar a dozen times a day. Well, that's more than one finger per finger for the rest of your life. So there are, finger stick monitoring is very informative, very valuable, and not without problems.
Right. Because the difference between the blood sugars versus A1C, so A1C is looking at that whole, it's much more global. And so I do have my test next week, and I'll be testing my A1C again because I put myself on metformin.
And depending on how your body's responding to your good attention to addressing this, A1C is a good broad measure of how well someone's diabetes is being managed, targeting to get it under 6 or even under 5.8. Is that still
5.8
sorry,
is the
I've been
number,
retired a
yes.
couple of years. I just wanted to verify that I remembered the numbers correctly.
Yes.
Sometimes, though, A1C doesn't represent the irregularity of blood sugars throughout the day. It's not exactly an average, but it sort of acts like an average. And so if you're having a lot of high numbers and a lot of low numbers, your A1C could actually be reasonable, but you're not feeling very good and you're not preventing complications. You're not well. So A1C is useful, but without frequent awareness of your
Right.
fluctuating blood sugar,
And
it's
what
not
causes the
enough.
fluctuation? Right.
It's not
You
enough
see,
to say you're doing the job.
that your pancreas is not working at certain times of the day. Okay. So these monitors that everybody wants, that you I assume this legislation is you're mandating that anybody should be able to get one of these.
So
It said whether it didn't say pre-diabetic, it didn't say diabetic, it looked like it was pretty wide open.
yes, so the intent of the bill is that whatever approach to blood sugar monitoring the patient would benefit from would be covered. So the bill draft includes the testing that you're describing with a device and a disposable test strip. You can only get one blood sugar result per strip.
Right.
So as
fast.
you note, the cost of them becomes very significant over time. The cost of the devices is not a big deal to
No,
most
it's
people.
$25.
It's the ongoing test strips. So the intent of the bill is to cover both those options, and to cover continuous glucose monitors, which are wearable devices. They're essentially the size of a quarter.
And how much are those?
I'm going to defer to, can I invite Liz?
Yep. Oh,
Yep.
absolutely.
Liz, come on up, help me out. So the CGMs attach, they penetrate the skin slightly.
Right.
Depending on the device, you wear them for 7 to 14 days and then replace them. And you can read your blood sugar from that instantly. I can
On
just
your-
take
on
my
your-
phone and
on
go
your
like
phone,
that, and
right.
it tells me what it is right now.
Right.
No finger prick involved.
Right.
Now, in regard to cost, there's, these continuous blood glucose monitors have been updated over the years. So I'm going to give you the cost of the Dexcom 7, which is the most recent one, and also the Freestyle Libre, which is another one produced by another company. And the average retail price for a pack of 3 sensors, which is a 30-day supply, is between $152 and $305, depending where it's purchased. So it literally can vary from pharmacy to pharmacy, because many of these devices are sold within pharmacies. Costco price, a lot of individuals have gone to Costco if they have a membership there, is $185. GoodRx, which is a place that a lot of us look at when we're trying to get economical devices, is about $72
$72
for a 30-day supply.
$72 for 30 days.
Yes. Okay. Now, if we go to the Freestyle Libre, which is made by Abbott, the price of that one through Costco is for one pack of 2 sensors. These can actually be worn for 14 days. Okay. The cost of that, again, through Costco is about $170, and through GoodRx, it's about $80.
Okay.
So I would just encourage factor that out over a year times the rest of your life. So I took the initial 152 that Liz said for the Dexcom for 30 days. That's over $1,800 a year for that sensor. It's extremely valuable to the patient and frankly to the healthcare system because we're reducing complications that are very expensive and very much adverse impact on quality of life. But it's a lot of money for people to keep up with. And I would also note that while sensors have improved, they do sometimes fail. They don't always say stuck on and you can't reapply that sensor when it comes detached. You
just
have to
gotta
get a new
do
one.
it once.
So
Initial,
these
right.
numbers per month are the least amount per month that it would be.
The other thing is for each of the sensors, it can communicate your blood sugar in two different ways. One of them is a thing called a reader, which is a device that you put it up against your sensor and it reads your blood sugar. Those average about anywhere from $150 to $200 a year. Or if a person has got a compatible cell phone, okay, they can actually have that information downloaded into
Yep.
their cell phone. And it allows, individuals to know where their blood sugar is, but it would also, let's say we have someone who has some cognitive impairment for some reason, it would allow another individual to also know where that blood sugar is and then get in contact with the person who's cognitively impaired. And if, the blood sugar is going too high, what's going on? Have you taken your medicine?
Wouldn't they be getting an insulin pump at that point? Wouldn't they?
No. Let's say we have
What
somebody,
percentage of people have insulin pumps?
it's a rather small,
It's
So what's the difference? So, I mean, because I think even when I first saw this legislation, I was thinking it was insulin pump. I didn't realize it was just testing. Okay. So the question is, do insurance companies cover, what do they cover now?
okay. The insurance companies, okay, will cover insulin pumps and they will also cover CGM, a continuous blood glucose monitoring,
Yep.
if you meet certain criteria.
6.5.
Pardon?
A1C 6.5.
Yes, and an A1C.
So this legislation is only for all those people who are pre-diabetics.
No,
because one of the other requirements for insurance coverage is usually you have to be treated with insulin. And the majority of people...
Put the mic.
Oh, sorry. One of the other requirements of insurance companies to cover CGMs generally is you have to be treated with insulin. And the majority of people with type 2 diabetes and everybody with prediabetes are not treated with insulin.
Yeah, but what is the threshold that insurance companies accept?
The
Is it,
threshold...
if it's not 6.5, which I was told
Oh,
was
no.
A1C.
You are correct about that. But that's only one of the factors to...
So you're saying insurance company has another requirement other than
Yes.
6.5?
So let's say your A1C is 7.2.
Okay.
So you meet the threshold that you've just noted.
Right.
But you're a person with diabetes who is not being treated with insulin. You are being treated with some other medication that may be
Metformin.
oral, maybe metformin, or maybe an injectable medication, but it's not insulin. We're very fortunate today. You began this meeting going back in time to the pre-COVID days. If I go back in time to my early days as a diabetes educator in the 1980s and 1990s, we didn't have very many tools in the toolbox for treating diabetes. Now we have a lot more pharmaceutical options that work extremely well. But one of the trade-offs of working very well to control blood sugar is the patient needs to be very aware not to have it overcorrect and go too low. And of course, there are a lot of variables that affect blood sugar. What you eat, how much you eat, your stress level, your activity level, how well you slept, hormone changes with monthly cycles. There's like a list of 25 variables that affect blood sugar. Those are the most common ones that I just said. So even if somebody takes the same medication dose and timing day after day after day, and appears to have a fairly predictable routine. You know, maybe they have a 9 to 5 desk job. Their activity doesn't fluctuate a lot on those weekdays. Even so, their blood sugar could be less predictable than you would expect it to be. And if they can't efficiently and affordably monitor it, then they can't respond to those changes in blood sugar in a safe and timely manner. So the insurance coverage, if you have type 1 diabetes, meaning you must be taking insulin to treat it, is good. But insurance coverage for people with type 2 diabetes or prediabetes for testing supplies is not good at all. It's not consistent. It's not adequate.
But it's preventative medicine. All right, this is not curing you. This is this is getting you knowledge. Knowledge is, important. Knowing your status, knowing what's going on is important. Okay, but that when you look at our health insurance mandates, and that's what this bill is. This is a health insurance mandate. When you look at our mandates were where insurance was that we had decided that this was something that really needed to happen, and insurance companies were erratic in enforcement. So you take the most famous one, which is mammographies. Okay, we mandate mammographies, and because we think it's so important, there's no copays or deductible for mammography. Okay. Also as true is a colonoscopy. Okay. These are preventative medicines. They're preventative treatments. They definitely have and I would say I've been here long enough. I remember when the issue was that the mammography was, it had to be a year and a day. On the pussycat, it had to be a year and a day, the year. So, it was that minutia of that mandate, as we had to revisit it, and let alone now we had to change the type of machine from the 2D to the 3D. And we had that legislation that one insurance company had a little pushback on. So these are mandates of mammography, these kind of things, the health issues, and there's probably more, and I'm just not really thinking about it at the moment. But that is very unusual for the legislature to step in and say this is appropriate care. Okay, and so that if we know that people these things such as these test kits and things are available, we know these patch monitors are available. And the insurance companies are saying, okay, they given any different one, all right, this legislation will only affect a very small portion of those who are insured. We won't affect anybody who's Medicare. We won't affect anybody who's Medicaid. We won't affect anybody who has a large employer. We're only affecting small employers who already seem incredibly, think that health insurance premiums are a huge, major punch on their budgets, okay, on their hiring people. They literally make a decision to hire somebody based upon whether they can afford what kind of health insurance they're going to give that employee. That's small employers. So what we want to say is this the cost and this benefit that you are describing? And I certainly hear you. I certainly hear that I know myself, all right? That the different times a day that I test myself, and certainly I'm all over the map with my numbers. Okay, there's no consistent numbers, and you think, I started out with saying I'm just going to do the fasting, right, first thing in the morning. Okay, well, only once did I ever break 100.
Because in most people with prediabetes, your fasting blood sugar is your best blood sugar of the day.
Exactly.
And if
But
you
I'm supposed to
only test
break
fasting,
but I'm
you
supposed to
could
be under 100. I'm supposed to be under 100 now. It used to be 130. Now I am under 130, but since you moved the number 100 only once with my fasting have I broken that. Okay, And I have stopped drinking sodas. All right. I no more ginger ale. Everything is diet this and diet that. And I'm eating 45 calorie bread slices. And I tried the keto, and that was not going to work for me. But I have done everything possible. And I convinced my doctor that 6.4, that you put me on the metformin. So I will be getting my test. So I'm excited to hear what my A1C is going to be
I am
come
too.
October 1st. Okay. But notwithstanding that, to mandate this, to tell all small employers, insurance companies, to mandate this for people who are pre-diabetic or just should know these numbers, it is in the scheme of things I think of all the things that people should be doing in terms of health-wise and how we eat and what we do, is this worth that
Can I-
burden?
I'd like to make a comment. I kind of agree about the pre-diabetic, but the type 1 diabetic, the type 2 diabetic that's being treated with some drug other than insulin, I think it's much more important. They are now diabetic, and we've seen and heard throughout our life and on committees here, what happens if you don't pay attention when you are diabetic. You're
Okay.
type 1 diabetic. If you don't pay attention to that, the side effects are kidney problems
yeah,
and everything
all right.
else. So
I got
if
it.
we limit
All
the
right.
bill
So the
to
question
that,
you were asking, and I'm not sure you guys will be answering because we can get the department to help us out. The question you have offered up is that the issue is that someone who is diagnosed is diabetic, they are not able to get this monitor, this thing you want, and we got to figure out how many people are in that position, and then whether this is a mandate that we need to pass.
And I think the insurance department will be able to speak to some of those numbers.
Yep.
And I do just want to say I appreciate the distinction and concern between prediabetes and type 2 diabetes. However, if you treat prediabetes vigorously, I used to say to my patients who were puzzled about, well, what's prediabetes? Don't I either have it or not have it? I'd say if you treat prediabetes as if you have full-on diabetes, you can largely prevent or at least greatly delay getting the blood sugar numbers that are diagnostic of diabetes. Because when you change lifestyle and reduce your numbers as you're working hard to do, your body becomes less insulin resistant. It becomes more able to manage blood sugar. So I think we have two separate but maybe parallel considerations here. There's value to this monitoring for people with prediabetes. There's probably greater, more essential value to people with type 2 diabetes who don't take insulin, but will develop complications of diabetes if they don't have the capacity with the right resources to manage the diabetes effectively and control their blood sugars.
Okay.
If I could just make a comment, it's in regard to individuals with type 2 diabetes that are not on insulin. I'm thinking about the ones specifically that are on what we call a sulfonylurea, which is a type of pill for diabetes. These have been around for years and years and years. And these cause the pancreas to produce a continuous amount of insulin until when we get into our older years, they no longer work very well. And then people end up sometimes on insulin, not always, but sometimes on insulin. These sulfonylureas can cause low blood sugar. And if after many years of having diabetes, many individuals, both on sulfonylureas, but also on insulin, lose the ability to recognize low blood sugar. And they are fine 1 minute, cognitively impaired within a relatively short period of time because their blood sugar has dropped so low and there isn't enough sugar getting to the brain. And they can get to a point of having a seizure.
I got you. Here's what. Obviously, we hoping this patient is under proper medical care.
Yep.
And I have no doubt that a physician can write that prescription to require this monitor that you're looking for. So
Yes.
we're not talking about those people with this legislation, because those people are getting covered. All the doctor has to do is write that prescription, and the insurance company will write it. Now, if you believe that the insurance company won't write it, okay, then we have a problem. But in my mind, that given that everybody is different, if there's a place where a physician is concerned about what's going on with a patient's health, okay, but if you're thinking that you're going to give this skill to a patient for them to self-diagnose and say, boy, I got this problem and I need to be dressing it simply because I'm following these numbers or not, we all know people, once they have these things, these test kits, they're testing or being resourceful and doing it on a timely fashion or a regular basis drops off. We agree to that in the beginning. So all I'm doing right now is trying to rationalize, where the insurance companies should be covering it, and we then cross our fingers and hope.
Aren't we
being
saying, though,
public.
that, but at least in my mind, and forgive me for not jumping onto the pre-diabetic aspect of it, but in the type 2 case,
Yes.
these things are not usually prescribed, or I don't think they have access to the insurance if they are. Type 1 guys, they got everything.
No, we don't. This is not.
Not-
about
we're not
type one.
worried about
this
those
is
guys.
type. This is type 2. This is
It's just strictly the type 2.
right.
Is we get them the test kits, the appropriate, whatever they're called,
Right.
test kits and everything else. And we mandate that the insurance has to cover it. If they are diagnosed with type 2 diabetes, they get it. And if the patient doesn't want to do anything with it, and I've known people like that, that's their thing. We can't
Right.
help that. But we should be able to get them the test kits.
That's what we want to find out. I personally believe, based upon what I learned, that yes, the insurance companies cover it. Yes.
So a couple things. The situation that Liz described of low blood sugar, hypoglycemia, unawareness that the patient's no longer symptomatic, they don't get
Right.
physical cues to tell them they're dropping. And you responded that then they would be eligible for CGM. They would be with prescription. However, they would have to have some kind of episode that put them at considerable risk in order for it to be known that they were having hypoglycemia unawareness. So if that person is driving while they have low blood sugar, people with low blood sugar drive like they're DWI. You're not a capable driver when your blood sugar is profoundly low. But if you don't know it's dropping and it's dropping abruptly, you have no warning.
Yeah, but how does
So if you have a CGM, it alarms you.
okay, but
it
your
beeps or
the whole
bops or
point is
whatever.
that this is a proactive patient trying to head that off, right?
Yes.
To head that off. And your assumption is if we just give it to them for free, then everyone will do it. No. The
So-
point being is that no, the person doesn't really know that they're heading that way. If they're going to get to their doctor's office every year and they're getting their A1C every year, you'll be in the same place that I am, is watching it climb. Okay, and then you'll be. But in terms of having an incident, holy moly, no, this bill doesn't do anything about someone who's having an incident out of the blue.
Well, it would, because if people were wearing the CGM,
No, but why would they
They-
be wearing it?
because they're a person with diabetes who wants to manage their blood sugar well and in a timely manner and be safe for them and the rest of community. And I also wanted to note that there's a drop off in frequency of blood sugar monitoring with finger stip test
I
kits.
heard you tell me
With
that.
continuous glucose monitors, the majority of people who use CGMs continue to use them indefinitely and benefit from them regularly. It doesn't drop off in the same way that it does with finger sticks.
Okay, great. Let's hear from the insurance department. Okay, thanks, because we're running tight on time here.
Sure.
Okay, thank you. Sorry to cut you
Thank
guys
you.
off. You guys still morning?
Good morning, Mr. Chair. For the record, my name is Jason Azes, Director of Health Economics, New Hampshire Insurance Department, and I really, really hope that you go from the pre-diabetes state to the non-diabetic state.
It's great.
So stay on track.
We're all hoping for the best.
So the department published a report in response to the request of the board, this committee, and we're here to answer any questions.
Okay.
Yeah, I'll let you open up.
Okay.
the
Well,
questions.
needless to say, the report showed it will be very expensive to implement this mandate.
If that's your
What
interpretation.
do you
yes.
want to repeat the numbers so we have it on file? Yeah.
So we tried to model this very complicated study that seems simple on the surface, but it really is indeed not, to try to identify the previous eligible population who is currently getting benefits for this service, what the marginal cost was, so what the per capita cost per year for each patient was, and then try to interpret the legislative intent of the bill as in its current form to try to predict or offer a prediction for this board to look at the expansion of the new eligible population. Then we went on to try to predict, I think, answer a question that you just had in the previous testimony, what proportion of the new eligible population might take up this new benefit? Oh, wow, I can get one of these. They look great and it's covered with no cost sharing. I want one, right? But presumably not 100% of the population, the expanded population would. So we just modeled it based on the previous rate of uptake, which is approximately 26% of type 1 diabetics and type 2 diabetics on insulin. So we presumed that because the acuity of the diabetes was a main driver for the uptake rate, that would be an assumption that would be reasonably met, 26%. So we modeled all of the statistics that are in the report on that. And that's what you see. I think the approximate annualized cost was about $1,380 a year for all parts of the legislation, including 2 visits to a diabetes educator for important guidance on how to use the device. It's noteworthy that I think in the bill it mentioned 3 visits over an 18-month period, but because the lens of this report was a 12-month period, we took 2/3 of that, which was 2 visits. So that plus the device and the supplies was approximately, had a median cost of about $1,380
Okay.
a year.
All right. Now, what do we know about when it is being covered? I mean, what in terms of insurance companies and what is, do we have, is it true that that they all require you have to be an insulin patient to be able to get these?
So the first bullet point in the executive summary mentioned an important concept that I think after hearing the uncertainty from your interpreters, I think it's worthy to mention here that in 2022, we did a fiscal note for, I think when this was an LSR, and we only
Right.
had the 2022 data. In that data, we saw that 100% of the population in the commercial fully insured market, and some self-insured, was entirely type 1 diabetics. But that changed and it migrated in 2023. And we saw that there was now a population of type 2 diabetics on insulin that were in that population. And that piqued our interest. So we started looking at language in Medicare guidance for coverage for this, and indeed began to note a parallel migration away from more intensive insulin therapy indications to less insulin requirements for coverage.
Okay.
So I think it was for Medicare coverage, as an example, a tangential example, because this is not in the commercial space, but it was required that 3 multiple daily injections of insulin were required for Medicare coverage. And then as of April in 2024, just recently, that went to 1. And that's where it currently stands now for CMS guidance. For Medicare coverage, you still have to be on 1 insulin injection for benefits.
Okay. And so you're saying for Medicare, That's
Yes.
also the Medicare requirement for a type 2 diabetic.
Yes.
To get this for free, you have to be getting an insulin product.
Right.
Okay. All right.
I think it's also worth mentioning that, as treatments for diabetes evolve, the medical guidance and the medical guidelines for coverage are also going to evolve. So I think that's kind of what we saw in our report as well, is when we look from one data year to the next, we've seen that evolution of how, coverage is shifting because of standards changing.
Okay. Could you be getting one of these under what is it? I remember this is kind of the infamous one of the categories that we have on health insurance is it's supplies or it's medical equipment. Isn't it like
So,
hearing
yeah.
aids were originally under that category?
Yeah, communicated in a narrative form in the report was we addressed that some devices are the benefits are administered through the pharmacy benefit, whereas for others through the medical benefit under the DME or durable medical equipment.
Durable medical. That's it. There we
Yeah.
go.
Yeah, and I mean I think that varies not only just with CGMS devices but also insulin pump therapies, and there are lots of other examples, and that non-standard approach can be problematic probably for carriers and providers alike. Oftentimes there's migration from among manufacturers to demand those benefits be administered for their device via one versus the other pathway to achieve optimal reimbursement rates. I think is probably one of the targets.
Yes, Carrie.
I have a question. If a person is a type 2 diabetic and they're taking one of those alternative medications, that means they do need their blood sugar controlled. And for some reason, I don't know why you would take insulin versus one of these other medications. But why is that considered something that it seems as if the coverage says, okay, you're on this other medication, but you don't need to be monitored as much as you would if you were on insulin, but you are on medication and you do have a blood sugar problem. So why is that separated out? Can you,
That's a good question. It's at the heart of this issue. I think that diabetes essentially means to siphon. It means hyperglycemia as a proxy. But really, the highest clinical utility, the clinical utility for these devices that got them to break through onto the market was their protective effect against hypoglycemia. You can see a proxy of that in the previous indications for hypoglycemic unawareness. So it's really protective against that. Indeed, it has the highest clinical utility, one which precipitates the coverage for this marginally expensive device. The question, it begets your question and future questions about how much clinical utility from a quantitative standpoint is there for hyperglycemia. It's noteworthy that there would be two distinctly different utility curves for both hypoglycemia and hyperglycemia, and that's the challenging decision for this committee, and it's really verging on cryptic because not a lot of people know what utility curves look like.
Okay, well, I keep telling people I'm not a doctor, and unfortunately, I have to feel like I'm practicing as a doctor sometimes here. So let's do it in my simple terms. Is that you're over 6.5? You're in the diabetic category. Okay. Does these monitors have an alarm system to suddenly tell you you're hypoglycemic, you're having an event? Okay. So then the interest would be how many people who are been defined as type 2 and are not monitoring at all.
The prevalence of unmonitored type 2
Yeah,
diabetes?
in other words, and I guess we can't tell how many are not monitored, but we can certainly see how much of people who are taking advantage of say this insulin, people who take insulin. and who are, because
Yeah.
I have a sneaking suspicion that even people who are taking insulin, they don't, you know, they are so confident in themselves, they know what they're doing. I mean, let's say I know a lot of people who have type 1, and those type 1s, they know their bodies, you know, they really know their bodies. But I can't say a lot about type 2 because, you know, it's late onset. So the issue is, what Carrie was saying is, what if you're, you know, if you're really on, you're really a diabetic, shouldn't you be able to get one of these monitors, if nothing else, that if you were to, you know, tap out, because you're all of a sudden your pancreas just, you know, was really sluggish and really not doing its job.
So table 1, we aim to communicate that in the report. About 37% of all diabetics take at least one insulin injection daily, and approximately 30% of type 2 diabetics take at least one daily insulin injection. So
So-
recall that it's insulin, or the previous testimony shared that sulfonylureas and other non-insulin, even metformin, can cause relative hypoglycemia, but insulin, without question, is the most powerful anti-hyperglycemic agent. But we put those statistics in there for the context of this report, so you could understand how we define the eligible population, the percentage of the diabetic population taking insulin.
Okay. And so before we do, you know, end this and then and get back again, most of the time when we do health insurance mandates is we put some guardrails, and in terms of how do we narrow it and how do we are doing it. So right now, I guess I want to know what the insurance companies are offering to people in terms of what, you know, what their status is and what they're able to get. If somebody, instead of having right now, we're, you know, obviously the legislation is to give it to them for free, no deductible, no copay, nothing, and that's almost an anathema to this committee. In this committee, we do expect the patient to have a little skin in the game. So is there something, other things? I mean, I don't know what we ended up doing with hearing aids, but is there other things that are comparable that had the same health insurance mandate in terms of those kind of governors?
I'm not sure. I think I heard a message. We have one of the major med carriers here,
Yes.
so I don't want to speak for them. But as a preliminary measure in creating this report, we queried the 5 major med carriers to ask them to share, and they willingly share their guidance. And I believe all of them required some form of insulin therapy for coverage for this in all diabetic
Right, we get.
populations.
I got over that threshold. Okay.
Okay. Yep.
So, and then when they require that, is there a copay or deductible even if they are on insulin? Is it free like this bill?
So in
Actually, maybe we'll have answers.
okay, yeah. In the report, we included a table with cost sharing.
Yeah, and humor me, just send the report out to all of us
Okay.
again.
Because did you have the report?
I do remember getting it.
Yeah,
yes.
so it
and I
showed-
remember scanning it, but I can't say that I
We-
read it
In
closely.
all of the claims for 2023, we saw $0 of cost sharing. There were a
They were-
couple. Yeah, median cost sharing was really, really low. So the cost sharing burden as it currently stands is very, very low.
Okay.
And that's in a table in the report.
All right. Great.
Okay.
Thank you. You have any more questions for him, or can we have Sabrina?
I'm still a bit hung up on what I was mentioning before. If somebody is a diagnosed type 2 diabetic, which means that eventually, I assume, and I don't know the progression of how this works, if they don't take care of it, they're going to be a full-on diabetic. And if they don't take care of that, they're going to end up really, really with problems. Why? I don't understand the calculation that goes into saying, well, you are in fact diabetic, but we're not going to help you with the monitoring the way we would with just one injection of diabetes, even though you are on drugs.
That's a good.
And that may not
thank
be
you
a
for that.
question for you.
Well, I'm not sure that I would characterize it that way because it's important to note that, and I'm a fan of Representative Damon's legislation and continuous glucose monitoring. I have one, my daughter has one. There's high utility to it. It's important to note that that's not blood glucose monitoring, and it may not necessarily be true that they don't have ability to monitor their glucose. They do have robust benefits for blood glucose monitoring, which is a much more directive pathway. Continuous glucose monitoring sensors don't measure blood glucose. They measure interstitial fluid glucose concentrations. That's a proxy for blood glucose. That's important because it's not known that high interstitial glucose concentrations cause any of the disease states associated with diabetes, like blindness, kidney disease, and lower leg amputations. Rather, hyperglycemia, which means high sugar in the blood or high glucose in the blood, causes that. So a more directive way, albeit inconvenient, painful, and sometimes dirty, of a way is to use blood glucose testing. This is that's right, which is cross-sectional. Right now, what's my blood sugar? It didn't tell you what your blood sugar was an hour ago.
No, it's momentary at the moment.
At the moment, or what it is going to be in an hour. But continuous glucose monitoring sensor is a great innovation. I tried to describe that in the report, how that became innovative, but it wasn't until strong improvements in the correlation between fluid glucose concentrations and blood glucose concentrations became acceptable for that to get FDA approved. And once that happened, all right, it's a great proxy, albeit a little bit less cost effective than finger sticks, but presumably more comfortable according to some.
Right.
It's
More
not
apt,
true-
more apt to get to test it.
That's
More apt to
that's
get
right, and I laud Representative Damon's point that she made about compliance and the drop off. You know, the current state of knowledge about CGMSs is constrained and some might say plagued by publication bias. That epidemiological data is really lacking right now on the benefit and reduced relative risk for long-term complications associated with diabetes from CGS monitoring versus blood glucose, but that's coming soon. And so that's not a trivial concept in this debate. But
Great.
type 2 diabetics have the opportunity to test with their blood sugar, which I would call that a close substitute. Or maybe CGMS inversely might be a close substitute to blood glucose monitoring. It's a
Got it.
fabulous innovation.
Great. Thank you.
Thank you.
All right. You have another question? No. Okay. All right. Great. All right, Sabrina. Sure.
I just wanted to respond to Carrie's remarks about type 2 diabetes. So type 2 diabetes is real diabetes. It's not any less concerning than type 1, but it's treated often differently.
It's treatable.
Because in
Type 1's not treatable.
Well, it's treatable, but in type 1, your body doesn't produce any insulin anymore. So you have to take insulin.
Right.
In type 2, your body doesn't respond well to the insulin that you make. And eventually there's a deficiency of insulin. But it's treatable in ways besides taking insulin, at least for a while. Does that help at all?
It does help, but to me that still means you got to monitor the devil out of this
Oh,
thing continuously
absolutely.
to make it work right for yourself.
I think one of the biggest mistakes from a public health point of view in the diabetes world is thinking that type 2 diabetes is less severe than type 1 and not taking it seriously.
I think you're right. I think that is part of the problem.
Great. Okay. Speedy, you get the last word.
I don't have my folder from last year with me, but I've had to dig deep through my emails to refresh my memory on testifying on this last winter. So I want to just level set a little bit because I think conceptually, of course, we all want people with diabetes, whether it's type 1, type 2, or pre-diabetes, to be able to manage it. I have people near and dear to me in my life who have diabetes. We care about this issue. I think the problem is about the language of the bill. It is so broad, and the scope of it opens the door for anyone to get these devices, and the price is capped at $30. And so I was just pulling up an email with our medical director, Dr. LaFleur, who's been doing this a long time. And he said the legislation is way too general, and it dictates this sort of cap and availability for anyone without clear guidance on it. And the jury is out on type 2 diabetes. I think my understanding is that in some cases, this would be appropriate. In other cases, it's not. And so I recall other carriers testifying to this too, that we constantly update our clinical guidance. And Dr. LaFleur noted that specialty societies in this space do not recommend the use of these devices in all patients with type 2 diabetes. And this bill would just open the door to that. And so I think that's our biggest problem with it, is that the language of the bill is incredibly broad. And so I think, I just wanted to bring us back to the sort of like actual language of the bill and what it would do.
Can Representative Damon and yourself get together and see where those broad holes are that maybe we can close up a little?
Yeah, and my sense is I'm not aware of there being like some broad problem. This also, in terms of coverage, this also brings us back to the question of coverage and benefit design issues versus no cost share versus capping something at $30 in statute. We also get to the fully insured versus self-insured issue. So state mandates only apply to the small, fully
Right.
insured market. I mean, not just small group, but the fully insured people in the state, which is getting smaller every year. And, self-insured plans are not subject to state mandates. And so, if there's like a real problem in this space, I think we need further discussion. I think the way this bill is drafted is so broad that it just opens the door wide open in a way that doesn't necessarily even address an underlying issue, if there is an issue, again, because of the small sliver of the market it would even apply to.
Well, it sounds like if those two folks got together, we might get something that was more compact and more direct. Is that possible?
Yeah, well, right.
I'm always happy to have
She
conversations.
said, Anthem is always willing.
We are, and I haven't heard complaints
And I'm
about
sure, Peter at Harvard and are all would love to have the discussion. So, but I would have to say, from what I'm hearing from Representative Damon, that any narrowing defeats the purpose in her mind, and that is you've got to make this available and hope for the best.
Well,
And so that's why I was trying to convince you to say that that's not, when it comes to health insurance mandates, we have this mandate that we're not supposed, we're trying not to harm insurance market, with something that could be very, very expensive, or it could not have any effect, and only a handful of people take advantage of it. You never know what will happen.
it seems that getting something much narrower through is better than getting nothing at all.
Right.
So if we can come up with something that's direct and makes sense in the market that we have, that we can do without destroying our insurance market, I think we ought to go for it.
Right.
And so I think in the end, we can say we recommend further legislation, but only if the parties can agree on the
But
scope
what
of
would
what
you
this
say?
thing is.
We're not recommending this bill in its current form, but that if future legislation that was addressed these issues, and the narrowing in terms of what is it, where is it that we really could have this benefit and have a long-term benefit economically for what it's going to cost to implement it.
Yeah, I think that sums it up.
Okay. Then maybe we
Thank
don't
you.
need another meeting? You don't want another meeting then?
I think from where we are in the time scale of things, November would be the next time that you would be able to come up with another piece of legislation. But I think sticking us in the middle of it without you talking to like Anthem or whoever is appropriate to talk to. Anthem is good because they're big.
Really
No,
big.
I don't. It's you two guys that have to come up with a meeting. I don't want to. We shouldn't be in the middle of this.
Okay. All right. Okay, so maybe we don't need have another discussion. I think you will see it in January when it's been introduced, but you might get it early because she might be looking for a co-sponsor. Okay. All right. We all set then? All right. Thank you all very much.
So thanks for coming. I just talked to Chairman Hunt. He's on his way. And I don't know if he was kidding, but he told me to start, so I'm going to take him seriously. So, I just move this up. He stepped out. He'll be back. Oh, okay. I guess we have to wait for Mac. Does anybody want to sing or something? All right, we'll just wait for him. There he is. Okay, we have a quorum. So we're here today to talk about SB 64. Originally, we were just going to talk about manufactured housing, but I believe that we're expanding the conversation to also talk about condo board resolution. So, Susan, did you want to say something? Oh, please, we'll be out of here long before that. Absolutely. Did you know that? I know, but he told me I could take over.
So's Christmas.
So anyway, so we're here. I guess we'll start with the manufactured housing, and we obviously want to hear what you all have to say. And we've had discussions. I know I've had discussions with some of you. I've talked with Chairman Hunt. I've talked with Representative McAleer, and Representative Thaxton has been involved. And I know that there are serious problems. We are not sure that it's a legislative fix. We're not sure about that, but we want to explore it, and we want to, if there's something that we can do to help, we want to do it. So that's why we are here today. Actually, just debating whether we want to. I'd like to, if he's on his way upstairs, I was gonna start with Katie McQuaid, but once you come up, we'll start. Okay.
Thank you so much. Is this like a regular hearing where we say where we're from?
Yeah,
and
it's
everything?
we're more casual here.
Okay.
But
So I'm a Manchester resident. I work for New Hampshire Community Loan Fund. I don't really have a lot to say about this bill other than what I said last several weeks ago when we were here about dispute resolution is kind of needed in all parks, both resident-owned parks and investor-owned parks and condo associations, right? Anytime you have people living together, you need dispute resolution. I would love to just turn it over to some of the folks that came. We have representatives from both resident-owned communities and investor-owned parks who have a lot to say about the bill. And so is that okay if I just...
yeah, I was thinking that before we do that, I think
Sure.
I was wondering, Karen, Susie, does it make more sense for you to talk from your perspective, or do you want to hear from the other folks first? Okay, all right, then that would be
Okay.
fine. Actually, Representative Almy, do you want to speak to your concerns, or should we start with the manufactured housing, since most of the people are here for that? Okay, so who wants to come up and speak first? Has something to say about manufactured housing? I guess I have to take notes.
My name is Patty Cole. I live in Great Brook Village, which is an investor-owned property in Belmont, New Hampshire. There are a total of 65 houses there. I'm here specifically to ask the subcommittee, to add in investor-owned communities to the bill, and also ask that the Board of Manufactured Housing be brought back under the umbrella of the Office of Professional Licensing and Certification. I understand that that board was disbanded last year. You'd never know it because all the information is still on the state website. It's all there. So we sent a complaint specifically about our park rules, and because that was what we were told who would address it, because the property manager through the owner was not taking care of our property. So we need a mechanism to be able to go to for dispute over park rules. Rent increases, totally different subject. We've dealt with that also. We're still dealing with it to the point where we now have an attorney and we're taking him through Haven't gotten to court yet, but we'll be there soon if nothing works out. But my goal here today is to ask you to please include all manufactured home parks in the state of New Hampshire, resident-owned or investor, and also to please bring back the Board of Manufactured Housing under that umbrella of the Office of Professional Licensing and Certification. And that's all I have to say. Is I have to get back to work.
Can I just ask your name again so I can get it down?
I'm sorry, what?
Can you tell me your name again? I'm trying to.
Patty with a Y, Cole, Cole. I live at 11 Lilac Lane in Belmont, New
Belmont.
Hampshire.
Okay, perfect. Thank you. It's hard to take notes while doing all this, but I will try. Thank you so much. Who's next? Anybody?
My name is Anita Durrett.
Another Anita. Okay. That's right. That's right.
And I am living in Stony Brook Park in Seabrook, New Hampshire, which is an investor-owned park. And I'm also the treasurer on the board of MODA. And I also am the person who gets an email from people. And this manufacturing home ownership is new for me. I just bought a home 2 years ago, so the whole concept is fairly new to me. But what I'm understanding is that since we lost the manufacturing board, there is no place for people. There just is no place. And the income level of manufacturing homeowners parks are on the lower income. I live in a 55 plus. A lot of them are 55 plus. And so people cannot afford to hire attorneys.
Right.
Our association is having a situation, and the association hired an attorney last year to deal with the park owner. And I'm not sure if we have some resolution, but we only have so much funds that we can spend on an attorney. So I would also like to ask you to please include investor-owned parks. And of the Gmail, on the Gmail account for MODA, in only the past 2 weeks, I have 6 complaints that I think are very serious. 5 of them are co-ops, and 4 of them are co-ops, 2 of them are investor-owned, and one of those investor-owned complaints is going to be to resolve, since the owner is taking no responsibility. It's going to be extremely expensive for them to fix the property, which they don't even own. But the owner of the property is telling them their driveway is their responsibility. And there's a defect under the ground, and so they don't have any money to hire an attorney. And
Right.
she's got a handicapped child who is in a wheelchair, who can't get on the school bus because she can't get down the driveway. So there's these issues where we have a document that we provide for people that at MODA, that's Guide to Resolving Disputes. And we have 2 recommendations that are government agencies, the Office of Professional Licensure and Certification, and then the New Hampshire Consumer Protection Hotline at the Department of Justice. Every single one of those people have tried to make contact and have been turned away. We don't help you. You know, Department of Justice will only get involved if it has to do with you getting evicted. So there is just no place for all these people to go, and with limited income. So thank you very much for listening.
I just
to
have
us.
You mentioned MODA a couple of times. What does MODA stand for? Maybe I missed that.
MODA is Manufacturing Homeowners and Tenant Association. We're non-for-profit, and MODA became sort of defunct before COVID. And the president, I guess, and like I said, I'm only new to this, so I don't know a lot, but he died. So, and then COVID came, and so things kind of went down, and so now we're rebuilding it. So we're still in the rebuilding phase of trying to get members and get people to be part of a solution or a help.
Can you say again what MOTA stands for? I was on the call last
Sure,
night.
sure. Manufactured Homeowners and Tenants Association. Am
Thank
I
you.
right? Did I say that right? Yes. Yeah.
Thank you very much.
Thank you.
Going back to this, you said the investor owners of your park said that the driveway is your responsibility?
They said, let me just get
Is that anywhere in any of the documents that you signed?
Well, I don't have his full, this is from a park, Interlakes Mobile Park in Meredith, New Hampshire is where this gentleman is from. I know for my park, we don't sign a lease, but last year our landlord set out all these new rules. So he's revised all his rules, and in that, it says that we are responsible for keeping up the driveway and the walkways, which we read that meant, we need to shovel it and, maintain it. Now, he is very clear, my landlord is very clear that he owns the property, he owns the trees, and, nothing's going to happen without his approval. We've got many driveways that are falling apart. In my mind, he knows they're his responsibility, but they're not bad enough, he's not fixing them. And we've got elderly people, disabled people, and there's cracks, and he doesn't deem it in need of fixing. And so they're not getting fixed. We have trees in the past year alone, we've had 3 trees fall on homes. We're a park. One of the reasons I moved there was because of all these trees. It's a wonderful, marvelous park, but he doesn't maintain the care of the trees. So he won't take anything down that looks alive, but he's not maintaining the trees. So they're 100 years old or more. They're beginning to die off. You have there's branches just falling off the trees. I'm going to be going back and battling because there's a branch that is so dead and it's huge over my house that woodpeckers are going crazy with. And all I want is for him to come and cut that branch off to protect my home. And he just doesn't seem too interested.
Can you hold on a second, Representative? Do you have bylaws in your?
Yes,
And have you read them?
The association has bylaws.
Okay,
He doesn't, MOTA has bylaws, yes.
but your park,
He does not have bylaws.
bylaws.
Our association, we have the Stony Brook Association, it's called SALT, and oh my gosh, I can't think of what SALT stands for, Land Tenants Association. But, so within the park, we devised an association in preparation if he has, we want to be prepared if he ever wants to, if this park sells. I think he's in his maybe early 90s and promises that the house is going to stay in the family, but we've started an association so we can be prepared to possibly
Buy it.
turn to a co-op.
Okay,
So we have bylaws.
Okay.
All he has is rules. There is no lease assignment.
Just a follow-up, you mentioned that
That's good.
You mentioned that trees fell on some of the
Houses.
homes. Do you know how that was resolved? I mean, if my neighbor's tree falls on my house, I'm going to sue him.
Right. No, it's an act of God. And so it's whatever you get out of your insurance company is what you get. So as I was on that board until I had resigned last election so I could be on the board of MOTA, and I looked into how much can you go to small claims court, and it's up to $10,000. I know that one of the people had the tree fall. It was in the middle of like a typhoon. She called Mr. Brown. He didn't even come. And he said it was a Friday. It's like raining like you can't even believe. And he said, I'll have somebody out there by Monday. Now a tree's on her house, the rain is pouring into her home, and he's not going to have a tree guy till Monday. So she had the tree removed and another tree that they deemed was dead. And it was $3,000 just to remove those trees. And
So-
he said you didn't have my permission to remove the
So
trees.
do you have a lease?
No, we do not have a lease. We have park rules.
Park rules set by the owner?
Owner, yes. No lease. Just you're supposed to sign. Now, I refused to sign the lease because when we hired the attorney, the association hired the attorney to address some of the issues in the new rules. For instance, the trees. I mean, there's several other things, but, we had a special meeting and he came with his son and I caught him in an outright lie, but, nothing was resolved. And so I told him, I'm not going to sign your rules until you resolve my concerns.
So you were asked to sign a lease and you didn't?
I did not sign a lease. There
Okay.
is no lease. There are park rules. That's
Okay.
very different than a
Yeah, yeah.
lease. So I didn't sign
Yeah.
the rules. And there are no repercussions.
Yeah.
I mean, overall, I'm very satisfied with him. I think I think he cares a lot about his property and the people. Why this tree issue is, I'm not really sure. And the other issues that we have, just business.
Right, right.
He's a businessman, you know? So, but you're putting people's lives now in danger as far as I'm concerned. So that's a problem.
So, I've been doing this a long time, and I'll never forget this. This is going to be almost 30 years ago, and the issue that you brought up about how the AG doesn't want to get involved unless someone has been thrown out.
Correct.
Well, you know, the AG would get involved if you had a lease, because they would be treating you like a renter, and we have very extensive statutes on renters' rights. And much to my surprise, when we were going through this type issue, the state of Connecticut mandates that you have to have a lease.
Mhm.
And that was the resolution for your situation, which is a, you know, privately owned park. That if you had a lease, then you'll know how much the increases in the rent will be. You'll know, you'll have everything, and then in there will clearly state how they're going to deal with driveways or
Right.
trees.
Yeah, no, but you can't make him, I mean, I don't know if he perceives the new rules to be a lease. In my mind, I mean, I've been a homeowner and owned income property. I think there's a big difference between some rules and a lease.
Oh, there is.
So
There is.
we are not signing a lease. We
Right.
are acknowledging his rules. And some of the rules that I engaged in disagreement is he wasn't even following RSA 205A. So, and he said his lawyer put this whole thing together. And I said, funny, I was told by, I think somebody at Community Loan Fund, that this is basically, does anybody remember that? That what he had is written up by the Community Loan Fund, like I don't know, remember rules, but he had basically copied and pasted someone else's document in a lot of it. So he's backed off. Shortly after, I did notice a lot more of his tree guys around town, around town taking some trees down. But the association put together what we call our tree form. And it's kind of a map and,
Yep.
to submit it. And we are just trying to get people to put everything in writing and have your documents. So if the only thing is really open to you is to take them to small claims court, well, at least you can do that. But if you're just complaining
Yeah.
and calling them and complaining without a paper trail, we don't have any way to really protect ourselves. So I'm working on that end there.
Oh, sorry.
Hi.
Hi.
So I guess I have some questions about your testimony. One of the kind of going backwards in it, you said something about the rent increases. It's my understanding wrongly, but rent increases are severely restricted in manufactured housing parks.
I didn't bring up rent
Oh,
increases.
oh, okay. I think they're restricted to $15 a month
Mm-hmm.
per year.
Unless
So-
you can justify an increase.
Right. So
You'd have to show us
you have to show your
documentation.
taxes or water
Right.
bill or something went up. Right. So you effectively have rent control on mobile home parks. Uh, I'm not sure and in New Hampshire, there's no requirement that leases be in writing.
Mhm.
So if a landlord says to you with a normal rental interval, which is 30 days, I presume, in your facility, they give you 30 days notice that as of 30 days from now, you have to mow the lawn, as an example, they have the ability to do that.
Mhm.
So I'm not sure the rightness or wrongness of it, the economics of it are outside the scope, in my opinion, of what the legislature should be involved in. My concern here is that I think you have remedies to this. I'm not sure what remedies you feel you don't have. You have the same remedies that any other tenant has. You can go to landlord-tenant court. You are a tenant. In fact, mobile home parks have a even greater constraint on them than a regular landlord. There's greater constraints than just under 540 A, which is mostly the landlord tenant code. So I hear things that are probably legitimate problems. You're concerned about a tree falling through your roof, or he doesn't maintain the driveway. And perhaps he should, or perhaps he shouldn't. And maybe he maintains your driveway, but not her driveway. Those are all individual issues. But I'm not understanding what remedy you were looking for from the I get what it is, but I'm not sure why this group of citizens should have a greater protection than they already have, since they have more protections than a regular tenant
Mhm.
in an apartment building or a single family house.
Mhm.
In fact, your landlord can't even sell his park
Mhm.
until it's gone before the community loan fund, and the tenants do or do not want to buy it. So he doesn't have freedom of sale. So I'm not really sure what more you want.
Mhm.
What now he's mean, and that's what I'm hearing here. I think you have all those protections. So
Okay.
that's my concern.
Mhm.
I think there's a different set of concerns which will come up later with homeowners associations on condominiums and things. And that would then also apply if you purchased the park. If it was a co-op, then there would be association rules there. But again, all these things are provided for in normal landlord-tenant law. They're also provided for in association documents if you purchased it. So I'm not sure why we need the mobile home
Mhm.
committee, whatever that commission
Right.
was. They did away with it because it had such little activity.
Well, I will speak to that.
Yeah.
Because MODA was defunct for a little bit, and so a lot of things were coming through MODA. People didn't even know it existed, and then COVID happened and everything sort of shut down. So, that's part of it. The question I have, you make a good point. I've never heard of the landlord-tenant, system. Certainly, I have not heard of it in MODA. But, where would that fall for us, that there is a park is being sold and the property is, I'm just making up numbers,
Sure.
but I have a neighbor who's a realtor
Yeah.
who just brought this to my attention
Me
as,
too.
as an occasion who this is happening. I don't know what park it just got sold, but the value of the property was something like $15 million.
Sure.
And a investment company came in and paid 24 million. So the people who were trying to make it a co-op can't compete with that. And you're we're closing the door of any lower income possibilities for people to be homeowners. And it's under the way it is right now is you're comparing to what it costs to rent. And if we don't have that, nobody's going to be a homeowner in the economic category of lower income people. And how can we compete?
Well, now you've taken, now you're on another subject.
But wouldn't that be a part of
No.
the mediation board?
That's not what this is about. And the proof is in the pudding. If you talk to your friend behind you from the Community Loan Fund, they do these things all the time. I can tell you that in Cheshire County, the majority of the mobile home facilities are now owner occupants.
Mhm.
So, and by the same token, you said you've owned a house and you've owned investment property. I imagine you sold some, or I imagine you sold that for a profit at some point.
One of them I did, yes.
Okay, good. And
I wasn't a landlord on that one.
okay, but
No.
your house you sold at a profit. So the question you just asked is the same question as if we turned that around and said, if you had sold it for a lower amount of money, then you
understand.
could have broadened the pool of people who could have bought it. And wouldn't it have been nice if somebody with less money had been able to buy it? That's not how a market economy works.
I understand.
So if you take the net rents on whatever they are on your facility that was up for sale that you referenced and divide it by 8.5, that's your sales price. That's a 8.5% return on investment. That's a conservative number. So I don't know. There's nothing in this bill, first of all, as I understand it, would get involved with the sale of properties.
Mhm.
And if it did, I would object to it even more strenuously. So we're really, at what point do you want to move out of a market economy? I mean, if you want to move out of a market economy and have things allocated and controlled by the state, then you're headed in the right direction. If you want to live in a market economy, then none of this is what you want. There are bad actors. There are bad actors in everything. There are good actors in everything. Probably neither of them get enough credit. But
You make a very good point, and I understand what you're saying.
so that's, those would be my concerns with this.
Okay, thank you. Can you tell me again, what is the landlord tenant?
540A.
540A?
Yeah, it's a book. Good. If you buy it as a book, it's
Oh,
about
yeah.
that thick.
And that is landlord tenant
That's landlord-tenant law.
law.
And it's under the Attorney General's office, and there is a free mediation service.
Yep.
Okay.
So you haven't tried that?
No, I haven't even heard of
Okay.
that. Again, I'm new to New Hampshire,
Yeah.
2 years, and things I don't know. But I thank you. I thank you for even listening to me. Thank you very much.
I actually have a question for the chair. Do you happen to don't roll your eyes at me? Do you know? You mentioned Connecticut. I thought was interesting. They're mandating a lease.
Yep.
Do they also have some I can't ever say this word. Specificity in terms of what needs to be in the lease, or is it broader? Do you?
I have
you
to
know?
admit, this was a long time
Okay.
ago, so I have no idea.
Okay.
But the end of the result was that most people do not have leases.
And those can provide
And-
protection.
And so over the years, when we've dealt with this legislation, we did have the price control, have some board that was to approve rent increases, and that's when we learned that you could have said, why wouldn't you have this in your lease when you buy when you rent it is true you're buying your unit, but at the end of the day you're renting the space, and so what controls do you have over the landlord, and generally historically the landlords have always been I guess you would say that they were gentle with their raises and gentle with it. And then, when it got really bad, then obviously we have the community loan fund stepped in because and everybody said, well, the answer is that you need to own your own park. That's the right answer. But as we now know, well, the other bill is that owning your own park, comes with a consequence of some elitist group of people who run the park and ignore the rules and do whatever they want to please, and so there, unfortunately there wasn't a lot of perfect solutions here. So.
Well, it seems to me that that might be an avenue to pursue about the leases. And very frankly, that's going to be dependent, the chances of it going through on which political party wins in November. And I won't say which is which.
Yeah, so I would say this is an issue could last a lot longer than our political cycle. And it's always been the assumption that eventually all these owner parks are slowly phasing out. And I mean, I know Jensen's at one point in time had, like a dozen, but I don't know how many they have left now. But so slowly but surely, those parks are slowly moving on to thanks to the community loan fund. So whether that's the right answer or not, I don't know. It's always been a problem.
Can I, two things. In terms of things that have to be in a lease, under New Hampshire law, a lease is subject to New Hampshire's statute of frauds. So it has some basic things that it has to contain,
Be included, right?
be included. But other than that, it's whatever you and
No, it's
your-
fair game for the rest of the
Correct.
stuff that's in there.
But if you don't have a lease,
Well, then you have well,
I'll never forget it was uniformly from MODA. And I'm trying to remember the lady who used to run. She used to be Lois, yes, and she was here. She was camped out in the committee all the time, and but she made it clear that they were not interested in leases because they always thought the problem with the lease was that it's going to be written right into it how much the rent increases are going to be and how much that some landlords would go a year or two and maybe not have any increases.
Yep.
So to them, a lease was a bad idea. That they like the fluidity of let's see how we're doing
landlord
and how the park
forgets.
is doing and how and that the landlord was just going to be pass on those expenses that needed to be passed on, and so ironically there seemed to be that it wasn't that bad, but obviously when it got got ugly and when we had property taxes started to go through the roof, that's when we created the land trust to give them a way to afford to be competitive, to be able to afford to buy the park back and for themselves. But notwithstanding, if somebody eyes that property to make a lot of money, turn it into something that they thought they could make a lot more money on it, yeah, you're not going to compete with that, and now you've thrown X amount of people out on the street.
Representative?
Just maybe you can give a little more clarification on 540A.
Yep.
Now, do I understand there is a complaint board or a
no,
complaint?
no.
There's a
Where
court.
did that come
There's
from?
There's a
landlord
court.
tenant
We actually had a bill this year dealing with the landlord tenant.
Yeah, it's called landlord tenant court, but it's easy to go into. It is designed to be.
No, where is this though? This is not under 540A?
Do you remember the discussion this year where we had about trying to get a tenant out of a house that refuses to leave? Remember having that floor debate?
I don't remember that, no.
Okay.
Well,
That-
540A is everything that's landlord tenant related in New Hampshire. All of which apply to mobile home parks.
Right.
And then they have another set of statutes that are on top of that are specific to mobile home parks. But so just within the parameters of 540A, the tenant has the opportunity to petition landlord tenant court to rectify whatever their issue. The landlord has got a tree, he's endangering my life. That's a bad thing. So they can go in and for $60 go into district court and say, here's my case, this is why. They have to make some kind of case out of it, but
Well, is that the answer that we're looking for? I mean, if
Well, it's
if
already
these
there.
people, well, then maybe it's, as I'm saying, it's sitting right before us,
Well, that-
possibly.
I'm baffled that they don't go to landlord tenant court. It costs $60.
has anyone nobody's heard of it? Okay, so you haven't
Well,
utilized
maybe that's
it.
the problem.
Well, I'm sure your landlord hasn't told you about it, but I'm sure they know about it.
I mean, for $60,
That's
We
the
don't have to reinvent the wheel.
No, the court will type up the service for you.
Does anybody else want to speak? Who's here?
Oh. I mean, it's not like one liner. It's like,
Is there any arbitration?
It's mediation.
yeah, it can be.
It's mediation.
Yeah.
Well, that's things arbitration.
Okay.
The judge will say you go out in the hall and talk about this.
Okay. Let's let this gentleman speak. And what is your name?
My name is Tim Caven. Could you turn your speaker on?
There you go.
Sorry. I think my cooperative is an example of democracy in a resident-owned community. It's a pleasure to live there. Now, I am a member of MODA. I'm also been the president of my own cooperative for 10 years. And I served on the Community Loan Fund Board of Directors. I served on the Rock USA Board of Directors. I serve on Rock Association, which is resident-owned communities across America. And I dealt with a lot of issues that surround democracy and cooperatives and how to help and support them. A great piece of news I heard today was that because I deal with investor-owned communities as well as this RSA 540, which I don't think anyone was that aware of. So thank you for that. I go away having learned something today. The only issue I have is that RSA 205A, which is basically for manufactured housing, to have an oversight committee or an oversight organization such as the Manufactured Housing Board is an important piece. But I think it's an important piece there's an RSA and there needs to be an enforcement wing for it, and the RSA covers resident-owned communities and investor-owned communities, and I think it would be a little bit discriminatory to only do one, only to have enforcement for one part of that organization. I think there are needs on both sides of that. I am certainly in favor of it because I think there is need for conflict resolution in communities, but it doesn't make any difference whether it's manufactured or resident-owned community or an investor-owned community. We all have our issues, and would like to see some organization that MODA could give information to people so that they would have some form of resolution to conflict that they're facing. In this day and age, affordable housing is depleting. The largest stock of unsubsidized affordable housing is manufactured homes. Resident-owned communities are notorious for keeping rents low because they don't have any investment. I should say return on investment need. And I can tell you that my community went a period of 10 years and had only one $10 increase in their rent. We have a lot of folks there that live on Social Security, and they can afford to live there. But I'm hearing stories of investors buying communities today because they are a top dollar. They're paying top dollar, and in order to substantiate that, they have to raise the rents beyond what people can afford. I'm hearing stories today of folks that have to move out of their homes in New Hampshire because they can't afford a $1,200 lot fee when it was $500 3 years ago. That's a travesty, and it needs to be dealt with, and perhaps this RSA 540 can help out with that. But in any case, my point is that I think that you've got an RSA that doesn't have really any teeth to it because there's no enforcement for it. And I think it's discriminatory not to, it's designed to protect all manufactured homeowners, whether they live in a resident-owned or not. And I think you'd be discriminating against one group if you didn't include them. Thank you.
Thank you so much. I actually want to direct this to Representative Thaxton. You know, I think one, you know, we put,
Oh, Jesus.
what the heck is that?
That's my phone.
I thought it was a pager. I got scared.
They'd blow up on you.
Yeah, I know. You know, Representative McAleer talked about mediation versus arbitration. The difference is mediation tries to bring the parties together. Arbitration, a decision is brought
Binding,
down.
correct.
So even if they go to landlord-tenant court,
Well,
Yeah.
landlord-tenant court's binding on both parties.
how is that? I'm trying to understand if it's mediation, how is it binding?
Well, it's not mediation. If you go to landlord-tenant
Yeah.
court, the judge is going to give you the opportunity typically to go out and work it out in the hall.
Okay, okay,
And then if you can't come up to an agreement, then
okay.
dad's going to make a decision. That's
So
how
it
it's
is
gonna be.
binding.
That's
Okay,
correct.
perfect. Thank you.
Yeah.
And that would involve condominiums as well and homeowners.
Well, no, I
No.
would have to read it. No, it's just,
Condos are not
yeah.
rent tenant, landlord tenant. If you read the definition right there, you can read it out loud to everybody. There you might go. Who is a tenant?
Tenant means a person to whom a landlord rents or leases residential premises, including manufactured housing or a space in a manufactured housing park.
Yeah.
Thank you very much.
And just so we're clear on 548, there's a lot of statute there. It's not like that was that's one little sentence. There's 200 pages.
Well, no, there's not.
Well, there's related.
What you're reading is all the case law.
All the case law comes back to it, yeah.
Which this book does have some of the case law.
Okay. So does anyone else like to speak?
Anita Durrett again. You know, to speaking to that, you know, I have read 205A, and I'm an educated, college-educated person, and it's almost unable to comprehend. So I'm going to look at 540. There are people in these places that aren't going to be able to read this stuff and comprehend what their rights are or what it means, and they're going to be going to the court by themselves, most likely, because nobody's going to be able to afford an attorney, and you're going to have the landlord there with their attorney. And the difference again between arbitration and mediation, at least you go into mediation, and we have landlords coming in and they're not even following their own lease. And so as far as rents are going, and I just think it's not fair to the common man to expect them to look at 548, you know, whatever it is, and 2058 to be able to comprehend exactly, because you don't write it in English. You're writing it in some kind of a legalistic, you know, writing that unless you go to law school, it's very hard to comprehend. In our MOTA meetings, we set aside a part of our agenda for them to go through that 205A with us to be able to explain it. The guy down the street in their house does not have that benefit.
Can I interject that? That sounds like it's a good project for MOTA.
We're trying, yep.
To I mean, I don't mean this in a disparaging way, because myself as a legislator sometimes struggles with some of the legalese, to dummy it down so that everybody, it's real easy to read.
Simplify it.
To simplify it. Okay, I shouldn't
Right.
have used the word dumb, because I think of dumbing it down for me.
Right.
No, I meant for me. Dumbing it
But
down
I
for me.
understand.
No,
And
you know
if
what
we
I'm
had
saying.
such a document, that would be awesome.
Well, I agree with both of those things. Many years ago, I worked for an insurance company, and they decided that they were going to simplify the English in their policies, which no one knew what they meant then. So, there's legal aid available, and I would many of your points are well taken. The guy who doesn't have your educational background looks at this and says, "What does this all mean?" But that's the situation for the single mother who's a high school dropout that's renting and has a Section 8. She doesn't know what her rights are, or may not. So all I'm saying is you're missing a whole big section of rules that are open to you. And if I would suggest that since you're very involved in this, if you go online to LexisNexis, buy their book on New Hampshire landlord tenant law.
Mm-hmm.
It will cost you $75, but get the association to pay for it.
Yeah, thank you, thank you.
Yeah.
But it's not just single mothers who are on Section 8. We've got
that's
elderly
my,
people
That,
who,
I completely agree with you on
Yeah.
that. I'm just using, there are inherent inequities in our system. Everybody can't win. And
Correct.
so the design of the system is to provide guardrails and make it so that everybody has the same opportunity. I mean, I used to like to bowl when I was a young man, and bowling with the bumpers out like you do with your kids. I mean, that's really not fun.
right,
But you win better. It's
Yes.
easier to win. So,
right. That is the point.
yeah, well,
Or you lose
where you lose, right?
if you're not as equipped as the
Yeah.
landlords are.
Well,
You've got
but
apples to oranges.
it is a constant challenge, but in this room, from my perspective, our issue is, do we need another piece of legislation which is potentially redundant, or is the matter that you have opportunities that you don't know about and aren't using, or is there something missing? And my point would be, it's not so much that we're missing something, is that there's opportunities that you're not aware of.
Correct. And that would be on the end of landlord tenant owned. But now you've got a law, sole set of laws, RSA 205, with zero representation for rock homeowners. That doesn't make sense. That
Well,
you would have laws that are unable to.
Would you just go over that one more time?
So you
That's what
have
you're saying.
rocks are the homeowners, they're co-ops.
Yes.
So you've got RSA 205A that are the state laws governing manufactured homes. Without a governing board or board that oversees those laws, the laws are really mute.
Well, you
They're
have the
not
court.
laws at all, unless you've got a lot of money to hire a lawyer to go up against.
So Representative, are you saying that it applies to those folks as
Well,
well?
you
in
would
the
have, you always, you can go into district court. I mean, again, if it's a land dispute, it has to go into Superior Court, but this isn't a land dispute. This is still, I guess I'd have to hire a lawyer to sort this out, what it is. But again, I would think the association would have some kind of counsel.
But what happens when the homeowner has to go up against their own board? That you got boards that are rogue. I mean, it's not an easy answer.
I had a thought on that previously, which is, first of all, how many of these boards are rogue?
I know I have,
5% of them, 1%. I mean, and which isn't to justify a bad actor.
Oh, God
But
bless you.
if they're violating their own agreement, that's a contract. And so you certainly have the civil option, but at some point, if it truly breaks that contract, you also have you should take it to the county attorney.
County attorney,
Yeah.
because every place we've gone to that we've known about to
Yeah.
lead people to,
They said we don't wanna
nobody wants
bother.
anything to do with them.
Well, I believe that.
County attorney.
How many
And I'm going to put your name attached that you suggested these things.
how many members are there of MODA?
Right now, I think there's 39. So we are building from the ground up. basically.
39 people or 39?
People. Let me say 36 people and 4 associations. So we've-
How do you become a member? Just pay
You
your
pay your
dues?
$25 dues, or the parks pay 75, and we have institutions that would try an institutional membership for things like banks and attorneys to be part for their own, because we need lawyers. We can't even get lawyers to represent us. They don't want anything to do with this issue. We have someone that has
no
been
money in
spent a week calling, because now you're getting into land stuff and that goes on for years, and we have lawyers out there who don't want any part of it. We've sent them to the your suggestion of legal aid. I believe, I'm not sure if I remember correctly, but I think they were interested if you were being evicted. If you're not evicted, they're not interested. You don't, you,
Thank you very much for that's real helpful. And I'm gonna I stop because I'd like Representative Almy to come up, who may have some more thoughts on this issue.
Well, there were a couple of things that came up. One of them is that the Manufactured Housing Board was repealed a few years ago. On the woman that was in charge of the Office of Professional Licensure and Certification left to become a judge last week, I believe it was, and there is a new sheriff in town there, and she was thinking she'd like to renew that, but then she thought, or they told her, that you are now just professional licensure and certification, so it can't be here. Next year, I'm going to be putting in a bill that you're going to hear a little bit about maybe afterwards, but you've heard a lot about it already. And I had found a new home for the Condominium Dispute Board, which is the Department of Administrative Services. And Charlie Arlinghouse said that he would do that at the time. So I've got to go back and talk with him about the Manufactured Housing Board, because really it did work itself out of a job, but then we got two new things happening. One of them is that the cost of any housing in this state has gone beyond our worst nightmares or biggest dreams, depending on where you are in the income scale. And the second is that people mostly from out of state came in and started all over the country and they started in the West, buying up manufactured housing parks and getting rid of the people that lived in them by raising the rents so high they couldn't afford it, and then turning them into whatever they wanted for that particular piece of land. And yes, that is part of capitalism, but capitalism from the beginning has always been considered to be necessary to put guardrails on it so that people from all levels of society would be able to survive and to provide manual labor and to provide for the elderly that fell after working as a middle-class person during most of their lives into poverty. And at least the volumes I've read. But the other thing that I wanted to bring up was that I have also never heard of this. I heard a little bit about the possibility of mediation in landlord-tenant. At the time I was looking at this, I also heard that the landlord got to decide which court it would be done in.
That's not correct.
That's not correct?
No. The court,
Okay.
court system is based on the town that the property is in, period, the end. And
I was
it's
told
always-
it was the town that the owner was in.
No, it's where the property is located.
Okay.
That's not,
Well, that's good.
that's the court's
But
fault.
the other problem is our court systems and our AG's office and our county attorneys and certainly the legal aid people are all underpaid, under-resourced. They don't have enough people to do all of the work that they've got already, and that's why they've been resisting adding extra stuff on there, and especially when it's not related to what they've been specializing in, which is
Well,
apartment buildings.
But
and-
it's, they have their whole, it's, if you go into district court in any county in New Hampshire, it's got a special window for landlord-tenant court. They're already set up for this. It's like they knew you were coming and they baked the cake.
Okay.
So,
Well, I think everybody should go and look at that. I'm going to go. I've got to go up to Grafton County in a little while anyway. I'll be looking at that. When I was 20 years ago working on a different project and spent a fair amount of time there, I never saw that window. Maybe it's new.
well,
But
maybe they just have it in Cheshire County, but I doubt that.
yeah. But it does. The other question with that is, how long is it going to be before they can schedule that hearing? Because the problem we have in condominium problems is that the person who, or people who are complaining tend to get persecuted during that time until a decision is made.
The courts,
Sometimes it's fairly violent persecution, but
well, that sounds like a police issue, but the dockets in courts vary from season to season and year to year and court to court. But again, only speaking from personal experience, in Cheshire County, you're generally on the docket within 2 to 3 weeks.
that's very good. I guess the people in Nashua should move there.
Please no.
Representative Carrick, can I ask you a question? You mentioned that you're going to put forth this bill for condo dispute board. Are you planning to include the manufacturing housing in that or not?
I'm going to have to talk with some people about
Okay.
this. It's just an idea that came up, but manufactured housing has one corpus of law and
Right.
condominiums have another. But it may be possible to put a bunch of this stuff together in separate sections with the existing housing court.
I think that would be an interesting avenue to pursue. Absolutely.
I have a question for the representative. You referenced earlier people coming in from afar and buying up mobile home parks and driving up rents, et cetera. And I want to go back to earlier testimony, which we all seem to agree on, is the limit on rent increases is $15 a month. Period. The end. A year. Not $15 in May and another 15 in June. It's an annual rent increase of $15 a month, unless a greater, some new and interesting cost can be established. That's in privately owned or investor-owned parks. So for $180 a year, I mean, I understand that if you don't have a dollar, it might as well be $1 million, but $180 a year doesn't seem like an excessive increase. Now, I know that in my area where many of the parks have been sold to the owners, they're the tenants, they're tenant-owned parks, whatever they're called. But
Owner, resident.
resident-owned parks. So, and I know many of them were shocked at the cost because where the former owner was charging $500 a month, now the actual operating costs are $800 a month with management fees and paying back the loan and whatever. So that's the only place in my area that I'm aware of where we've seen huge increases in the monthly fee to the association. But I don't know how an owner could legally raise the rent more than $15 a month.
I find that completely impossible to explain. Why would an owner, a investor, invest in a property and pay $13 million for it or something like that because it's near a lake, and not expect to be able to raise the rents a lot more than what you're saying?
Well,
How are they
that's been
surviving
that
if
was our
it's
te-
$15
That was
a
the
month?
testimony in this room earlier today. I mean, that's the law in New Hampshire.
It may be the law in New Hampshire. It may also be not enforced.
Well, it would, if that was the case, if you lived in a park and the law in New Hampshire says I can't charge you more than $15 a month and I justify it and I raise it $300 a month, you have zero chance of surviving in court. That's clearly a county attorney, but you could go in there pro se, and that just can't stand. They couldn't throw you out for not paying it. They can't.
Well,
It's like you can't. If somebody writes, I remember a policeman in my town once. Somebody came in and filed a bad check claim because they had written a check for purchasing marijuana, and because you can't make that claim if you took a check for marijuana. If you're breaking the law, you're breaking the law. So you can't go to court and say, I like this part of it, but not that part.
well, this is very interesting. I will be looking at that in my own area. We have one rock, and about a mile down from it, there is a resident, tenant
Investor.
tenant in, which is not what I would think of as an investor. It belongs to a 93-year-old man who they think is a pretty good owner. Unfortunately, when he dies, it will be up for grabs. And right now, these places are across the road, busy road, but across the road from Muskoma Lake. And the first rock in there managed a miracle to make it work. But that was 8 years ago. And now the cost of the land itself is probably up around those 10 million, whatever, just because of the place that it's in. So, yeah, you've raised a lot of issues that I want to go check on in another county, because Cheshire is one of the...
It's part of New Hampshire.
It's part of New Hampshire, and we're part of New Hampshire, even though people think that we're part of Vermont. But
You're going to pursue that, and we'll follow that and see if there needs to be a separate bill on that. But thank you so much for
thank
testifying
you.
today.
Oh, and I did want to also say, to agree that we really, if you're going to have an oversight board for rocks, which are already oversitted by the Community Loan Fund, we certainly need one for the otherwise owned, which would include the one owned by my friend down the road from the rock that is 93 years old and may die at any time.
Okay, thank you very much, Representative. Karen, Susie, do you have anything you want to add? Or? No, I didn't. I wanted to know if you wanted to add. No, that's fine. I just want to know if I'm not ending it. If you don't, that's fine.
Representative, can I ask a question of the audience? Is there anybody in the audience who lives in a manufactured home that has had a rent increase above $15 for the year? So there may be a law, but it ain't working.
No, the law's been repealed.
Up $70 this year, it's going up $75 next year and $75.
She's not in a private park owner. She's in a community-owned park.
Yeah, she's in a rock.
So if I can interject,
Yes, please.
there's a lot going on here. Okay. Karen Susi represents the New Hampshire Manufactured Housing Association. Okay. Manufacturers, installers, private park owners. Okay. We have a lot going on in this discussion. First of all, I would like to, hello, Anita. You and I would love to chat. I'm delighted that MODA is back. I think it's wonderful that the residents are now speaking up for themselves rather than the lender. I think it's wonderful. I had a great working relationship with Lois Paris, who led MODA in the past years before she passed. So I welcome that opportunity. Very important for residents to have an open dialogue with park owners. Very important. I'm hopeful that if you get back to Senate Bill 64 and you want to talk about the resident-owned communities, perhaps MODA might be able to come up with a dispute resolution program. You know, I would hope that residents, if there are issues in resident-owned communities, that the residents would want to resolve them. Okay? You want to talk about, now, did we go on to the Board of Manufactured Housing? That was actually repealed last year, not years ago. It was repealed last year. That was because I think 2019 was the last time they had any complaints, and most of the complaints that they received weren't within the jurisdiction of the board to be able to handle. So didn't have a lot of action going on. First of all, the New Hampshire Manufactured Housing Association had nothing to do with that being repealed. We did not suggest it. It came down from the top and down, just like everyone's getting rid of boards and everyone's making them advisory. Okay? So go for it.
Who specifically dissolved the board? The governor?
This legislature did. You voted to repeal it. Yeah. I think it was on consent. I can't quite remember the consent calendar. What else can I say? I think there are a lot of bad actors out there in every industry, in every aspect. But again, if MODA would be comfortable reaching out to me if they're hearing about an issue in a privately owned park, well, then by all means, reach out. That's what Lois did. Not a big deal. I've got a business card. And is there anything else I can answer for you? You want to talk about rent increases?
Yeah.
Okay, let's go. Rent increases. So I think it was in 2019 that someone came forward. It may have been Representative David Luno, proposing a rent control bill for manufactured housing parks for privately owned. And rather than do that, we offered, as the association, to have our MCAP program put into statute. Okay. And that reads that if the rent increase is more than $15 a month proposed, right? So if it goes over 15, the residents can petition and get 51% signatures from the park and move forward with a mediation. And I'm trying to think what else. But something to keep in mind though, that $15, which is still in statute today, that was put in 2005. So that's
Which RSA
that's
is
a
that
pretty
one?
low threshold. 15. Yeah.
Okay, so but the one that we repealed is what RSA was that?
That was also in 205A, I believe. The Board of Manufactured Housing. Yeah.
So, who would mediate that?
So we have a mediator that the association pays for, as long as, so, I'm sorry? Sorry, folks. The New Hampshire Manufactured Housing Association, I'm happy to meet up with you after this, okay? Very good.
Could not a mediator be a first choice for these people to go to? And I mean,
Okay, now we're kind of,
Yeah.
what are you focusing on?
well, we've got folks that are in these associations, whether they're privately owned or investor owned,
Mhm.
and they have complaints, and they don't have the money to go to a lawyer. Why not have some sort of a mediation board? And now you're telling me that there is one for some issues. Why can't it be extended for other issues?
Okay, so the MCAP program, the lot rent increase for private parks, That's something that we pushed forward, did to on our own, that we pay for the mediation, okay? Unless there's a park who's not our member of our association, then that park owner pays for the mediation. So that's something that we put forth. Now, if MODA wants to put something forward that says, hey, we want to come up with a mediator, wonderful. It's, residents should be able to take hold and move forward with that. I don't think that private parks should have anything to do with any type of oversight of resident-owned communities. This is something that the residents should have control over, not the lender, not privates, but the residents should have an answer, have something to help themselves move forward. The only reason I'm here is because I kept getting the calls from the residents in resident-owned communities. That's my only reason for being here.
I have a question for you. When
Sure.
you talked about your mediation for the private parks, is there any teeth in that? I mean, if you have an owner who says, I'm not going along with that.
Okay, so no, it's not mine. So mediation is non-binding, right? It's not arbitration, okay? So if for some reason the residents don't like the outcome, they can go to court.
Okay.
And vice versa.
Okay. Any other questions for Karen?
Who is funding this, the immediate, like, who is funding, who do you work for?
Okay,
New Hampshire Manufacturer, is it the?
sure. So her questions are, first, who do I work for? Correct?
Right, is it the landlords that are funding this?
So I'm Karen Susie, and I represent the New Hampshire Manufactured Housing Association. And the association is comprised of manufacturers of homes, privately owned parks, installers, lenders, insurers. I pretty much represent everyone as part of that industry.
Okay, let's try to let's come around. So, is there anything else that you'd like to add at this point?
No,
Okay,
not at all.
Thank you so much. I think that clarifies.
Sure, thank you.
And is there, I believe there was some other person who would like to talk. Sir. Yeah.
Good afternoon. My name is David Dwyer from Belmont. I live in a park called Great Brook Village. I'd like to address a few of the issues that have been brought up here. This one that we were just talking about was mediation. We had a rent increase imposed last year. We disputed that rent increase. It's a investor-owned park, I should say. So we filed the necessary paperwork to go to mediation, which was offered as a way to resolve this dispute. We got the necessary signatures from the homeowners. We arranged the mediation. As it turns out, mediation was not successful. We did not have an agreement. I and one of the other homeowners represented the homeowners in the park. The management company was there representing their side. The owner, the park owner, is from out of state. As it turns out, the only thing that the management company had to do was not agree to anything. So as far as mediation goes, it turned out to be a waste of time, frankly. The mediator, I'm sorry, I can't remember her name right now, the mediator brought the proceedings to a halt. And she finally said, we're not getting any answers here. I'm going to bring this to a halt. The management company stonewalled, did not answer questions again and again and again. The management company would not answer questions from the mediator. When he did say something, it was a series of unintelligible phrases that made no sense. And he would ask, after saying this, does that make sense? And the mediator looked right at him and said, no, please answer the question. This was not once or twice. This went on and on through the whole almost 3 hours of this mediation. So we followed the program. We went to mediation. Mediation was of no use. That disputed rent increase is still in dispute today. We made it very clear after the mediation that we're going to pursue it further. It was not resolved. And after listening to the, frankly, gibberish that we got during the mediation session, my analogy, I'll get off the track a bit here. My analogy is, if you remember a comedian called Professor Irwin Corey, who talked in unintelligible phrases, and he made it a funny presentation. That's what this guy did for the whole session of the mediation. So mediation was not successful. After the mediation was completed, I called MCAP, said we did not come to an agreement. What is our next step? What can we do next? And the reply was, we could hire a lawyer. Very expensive. But that's the only option that we had, was to hire a lawyer. We are presently involved in another rent dispute. We got a rent increase effective January of this year. Some rents increased 22%, someone else's was 16%, someone else was 19% year over year. I happen to have in my rental agreement a clause that limits the rent increase to a certain formula tied to CPI. CPI plus 2% to be exact. The management company does not follow that. They do whatever they want to do, legal or illegal. The rent increase effective January was much more than that allowable amount. Many people had a much bigger rent increase than I did. There is no consistency to the rent increase. There is no consistency to the new rent that a new tenant would pay. So there are a couple issues involved. One is the amount of a rent increase that is allowed, and thank you very much for the information about the RSA 540. But the rent increase is one issue. The other issue is the abusive practices of some of these investor owners that are raising the rent for new tenants at random to whatever they want. For a park like ours, the current rent is approximately $500 to $600 a month, depending where you are, depending on the park. Our rent is now, for new owners, for new people moving in, our rent is now $1,200 a month, $1,195 a month. So they're heaping these new, extremely high rents on new buyers, new tenants, new residents. In addition to that, the latest tactic being used is they're making the rent agreement a month-to-month rental agreement. So for the lot rent, they're offering the new residents a month-to-month rental agreement to rent the lot that their house sits on. This is unconscionable. How can people pay a month-to-month rent without being assured that they're even going to have a place to live? So they're essentially making the houses worthless. Sales have stopped, virtually. $1,200 a month rent. Potential buyers are just hanging up the phone and walking away. A month-to-month rental agreement. This is making it impossible to sell the place. So that the rent increase is one issue, but the abusive practices driving the rent so high that people can't sell their place is putting a financial burden on someone who there may be people who are depending on the value of their house, maybe for their retirement or whatever it may be. So I lend my support to this bill establishing the committee not only for resident-owned, but also for investor-owned parks. And if that's a method to help people resolve these disputes, to make sure that the landlords in the management companies abide by the law, If that's the way to get information out to people and help them resolve these disputes, then that's why I favor this bill.
Quick question.
Sure.
The rent that you pay, is that for the home or the land or both?
It's a lot rent.
Just the lot rent?
I
So you
own a home.
Okay,
I own a home. The rent is for the lot rent.
thank you.
Thank you so much. That was helpful. That was really helpful information. Anybody else would like to speak? Yes, sir. Are we blending it, or we want to, what do you,
No,
what do
you
you-
would finish this one up and then start up the
Okay.
other.
Okay. So we're gonna finish up if nobody else has anything to say about this. Sorry, I'm not talking into the mic. I think that what our committee needs to do is reconvene. You know, there've been, a lot of good suggestions about, solutions that may be available that people don't know about. But I think, our committee needs to also explore possibilities of any legislation that might be possible. It may not, but I think we need to take a look at it. So I think then we'll end this part of the hearing and we'll move on to the condos. Thank you very much. I'm going to take a 2-minute break. Okay, let's get this show on the road. Or the road on the show. Or get on the road, yep. Okay. Well, you were part of the discussion of including condominium. You wanted to include condominium disputes,
I
yes?
just thought that it would.
Yeah.
They go together very well. Yeah.
It's like soup and sandwich. So, I mean, is there a specific bill that, I know that you had wanted to be here. Is there a specific bill that you wanted to discuss? Or upcoming legislation? Okay. 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 Okay.
Turn on your mic, please.
Sorry. Susan Elmy on City of Lebanon, Grafton 17. We got redistricted and I'm the float. Also, one of the authors of every single one of those bills that's come through. And so you should know quite a lot about them by now. And you could see from the previous discussion that there are a lot of people in a lot of places that cannot figure out how to get adequate legal representation to be able to use the option, which is taking it to a court. We had early on two guys from a large association, condo association in Nashua, who were on, the association consisted of a main block and then an extra block they tacked on. And they were in the extra block that they tacked on. And they were all paying the same fees, but they were getting a lot less of the stuff they needed done, like fixing the floor that fell in and things like that. And they had enough money, they took it to court, said it cost them 2 years and $20,000 to complete the court case. And when they completed it, the judge looked at them and said sorrowfully, I think that you've really got a problem here, and I can't do anything about it because there's no condo law. That was early on, and that was why we started putting governance law into the condominium association law, which was originally just to catch bad actor developers that were selling to people coming into condos for the first time. That is, the condo was built and those new people were coming in, and to protect them from bad actor developers. There must have been a lot of them at that point, I guess, because they put that law in. But since that time, there have been years when nobody showed up to talk to us about their problems. Some years where we managed to help solve problems, and the people went away happy, and some years when we could not do that. And a number of people said that they were leaving New Hampshire because of it. And then last year, when we had a totally new group except for me, and we sat there, and the chair, Representative Infantine, decided that we ought to listen to the 6 people that were there in front of us. They were from 3 different associations and had 3 different kinds of problems that were all pretty mind-blowing. He had never run into a badly run condo association before he'd been in them. And I have not had those problems in my homeowners association, but there are a lot of places where people fall through the cracks. There are also places where we get complaints from people who want their neighbor to be told that they shouldn't smoke on their deck because the other person's allergic to smoke. And that kind of thing, we can't do anything about. I call them the pink flamingo bills requests. So, but we really need some kind of board like the Manufactured Housing Board was. The Manufactured Housing Board did put all of its decisions into the court. The court kept the decisions filed for 6 months and then entered them in as case law. And the what was then not the OPLC took all of the decisions and put them up on their website in a prominent place. And my opinion of why they ran out of things to do was that they'd run out of most of the things that could possibly happen until the cost of housing and everything started to change everything. But the current new head of the OPLC does not think she can take the Manufactured Housing Board back. She thinks some version of it should continue. And she has committed to keeping that website and putting it in another more prominent place again. If we decide that we need to have a Manufactured Housing Board as a subsection of maybe the Housing Board while we're deciding about condominiums, that's something that could go along with the Manufactured Housing Board, which would probably be limited to very rare occasions when they have to talk, but maybe not. It sounds like things are really changing a lot again in trailer parks. And so anyway, on the condominium side, we have no higher authority except the district courts. And the district courts are overwhelmed. And the people who can manage to find a condo lawyer, and your chair gave me a list, or got me a list of the lawyers that would listen, and I called all of them. And 3 of them said that they would talk to a condominium group or owner that were trying to figure out what to do. Only 2 of them had, and they listened to them and then commiserated with them, but just told them, sorry, nobody's going to take that case. One of them, the best one of them actually in my terms, in terms of being understanding about the problem, said that what you're talking about is not about enough money so that you can afford to do this. So I didn't get terribly far with that except to get a little more
interrupt you
information.
to ask a question?
Mhm.
Do you know how much money it might cost to institute a board?
Yes, you got a fiscal note right here.
Excuse
Oh,
me.
excuse me, the fiscal note is from the previous OPLC
Right.
person who also,
These numbers look a little high.
yeah, they are definitely high. She staffed entirely with lawyers. We wanted one, the board had Manufactured Housing Board had been staffed by one at first full-time and later on part-time on clerk who was on getting in all of the complaints, on classifying them according to topic, and then putting out, doing the minutes, of course, and putting out the call for the meeting to the heads, the owners of the Manufactured Housing Board and the on complainants, and then taking minutes at the meeting. And that doesn't need a law degree.
Right, right.
And the biggest problem that I see in doing something like this is that the condominium law is a very large chapter. And so we're going to need a lawyer who is, as the Manufactured Housing Board person was, thinking about retirement and has done some condominium work that would be on that board.
So bottom line, Representative, is that you want to move forward with this bill?
I am still
You're still going to do that.
looking
Okay.
to move forward with it. Representative Infantine wants me to finish writing it first and then decide whether he wants to come in on it. And Whitley, who was on the committee, has moved on.
So at this juncture, what if anything do you need from us other than to wait for the bill to come out to take a gander at it?
I don't need anything from you. I was kind of surprised you were having a meeting about it again, but it gives the opportunity for this gentleman to talk to why he thinks we shouldn't have it at all. So,
Okay, so you wanted to speak, sir?
I gotta go.
Sure. Bail. What's it?
Yes.
oh, I wanted to know that. That's real. That's true.
Okay.
Well, good afternoon.
Hello.
My name is Dick Sweat. I'm a resident of the Vineyards Condominium Association in Stratham, New Hampshire. We are a condominium association. We are governed by RSA 356B. After hearing the tales of the manufactured housing people, I certainly think that combining these two types of organizations is not a good idea. I mean, we have totally different structures. We have our ownership is different. Our problems are different. I just really don't see a combination of these two groups. I think they should be separate. The Manufacturing Housing Board should be under their RSA. Condominiums should be under 356B. I've lived in a condominium association for 16 years. I've served on the board for 6 years. I was president of the association for 4 years. I'm presently chairman of the Condominium Leadership Council, and I'm also representing the New Hampshire Legislative Action Committee today. Gary Daddario couldn't be here, either could Don Lennon. They asked me to step in their shoes. This bill, HB 1645, as Representative Almy said, has been around for a number of years. It's also very similar to a bill that was passed in the Senate, Senate Bill 324 in the 2022 session, and the House Committee declared that bill as inexpedient to legislate. This bill that we're looking at, the 1645, is quite similar to that bill. I think one of the major issues we have here is that the RSA 356B promotes the concept of self-government for condominiums. Once we get into a condominium dispute board, I think we are taking away that concept of self-government. during my years of the board, our resident disputes have been settled within the framework of the condominium declaration, the condominium bylaws, and the rules. That's how we have solved and settled our disputes. The members of the condominium dispute board, I think we have to think that condominiums are not all the same. I mean, there are owner-occupied condominiums. My condominium association, 76 units, is totally owner-occupied. And that's how we govern ourselves. There are other condominium units that have investors in them. They do rentals, either on a lease for a year, if that's what the bylaws call for, or they could even do VRBOs, which can cause problems for the condominiums. And there are also the seasonal owners. There are tension in these groups. The seasonal owners, the investors, like low monthly fees, whereas the owners want to maintain and have preventive maintenance issues to protect their investment, and they like to have a good, solid reserve account. If to have a good, solid reserve account, you're going to be paying higher monthly dues, and that's what some investors, seasonal owners, and other people don't want. I would say the procedure to follow to file a complaint with the dispute board really bypasses the framework of condominium declarations, condominium bylaws, and our rules. I think the idea that there's going to be a mediator in the dispute resolution board kind of intimates that the board might not want to handle all disputes. And if they send them to a mediator, as somebody pointed out, a mediator is not binding. They're not an arbitrator. They are a mediator. A mediator also charges pretty heavy fees for their time. So that would be an additional expense. I don't think the procedure timeline for solving these disputes is particularly timely. I mean, it's something where these disputes are going to go on for a considerable period of time. I think there's one issue in here that's really quite troublesome, and I'll read this statement. The board, meaning the dispute board, shall not be bound by common law or statutory rules of evidence, but may admit all testimony having a reasonable probative value. It may exclude evidence which, in the opinion of the board, is immaterial, irrelevant, or unduly repetitious. That's the end of that quote. And I don't think this provision does not provide sufficient checks and balances for this board's deliberations. I think the initial determination, unit owners can complain about the boards, but can the boards bring a dispute about a particular unit owner to the board for resolution? The initial determination about the validity of owner complaints are made to the dispute board, but before the association receives any information about the owner's dispute. Where's the transparency here? The dispute board will receive legal assistance provided by the Department of Justice. Condominium boards appearing before the dispute board will probably have to go and get an attorney to advise themselves, as they're going to be having an attorney opposing them from the Department of Justice, which is going to be advising the dispute board. I think all in all, the dispute board really doesn't have any full remedy. I mean, their remedy is to file an appeal with the Superior Court, and then the Superior Court would then enforce the decisions of the dispute board. I mean, this is kind of circular in a sense, because if you do have a dispute, that's where you go. You go to the Superior Court of the District Court. So I have to say that the establishment of the Dispute Resolution Board would bypass the concept of self-government, set up a time-consuming procedural process, attorney fees and services, and remedies would be administered by the Superior Court, the court that presently handles such disputes. So the organizations that I represent really, one, would not agree or would like to see a combination of manufactured housing and condominium dispute boards. And two, we think the RSA 356B contains sufficient framework with which to solve disputes. And also, it's very difficult to get people to run for the board of directors. And if people do have complaints, they should run for the board of directors. In our condominium association, we have term limits on the board just to make sure we have board turnover. But anyway, that is my presentation. Thank you for listening to me. I do respect Representative Almey's thoughts about needing protection for some groups, but I think the size of these condominium associations is important too. Size can run from 2 units, which are called condexes. You know, they're like duplexes, 2 units, condexes. They can be under RSA 356B to units of 500 units. So I'm not sure this dispute board is really a sense of where one shoe fits everything. That's
Thank you
my
very much.
testimony. Thank you very much.
Any questions, folks? Thank you. Thank you so much for your testimony. And I guess we will, on this bill, we will wait to see what Representative Almey is going to present to the legislature next year.
So just make sure, well, I mean, what it would be the status of HB 1645? I mean, is it,
Well, I guess it depends if,
pardon?
But-
I can't hear.
it's dead, but Representative Almey can do a new bill. if
Oh, I
she wishes
understand
to
that.
next
Yeah,
time.
I
Yep.
just didn't quite understand what I didn't understand what the procedure was here.
No,
but
I mean,
on the October, there's a meeting supposedly on October 17th where the full committee is going to look at this bill again.
yeah, that's, I didn't know it was the 17th.
What happens there? Nothing. So there's no need for anybody to show up.
So, I mean, the bottom line is that it's going to die, and then, the representative can pull out of, the last bill what she chooses to, and to presumably make some
Okay,
changes
so
to it. So,
Representative Almey will be submitting a new bill.
Exactly.
HB 1645 is
yep.
gone. Okay,
Yep.
thank you very much.
Thank
I
you so much.
Appreciate the understanding of this.
Okay.
Yeah. Okay, thank you.
Okay. Yeah, Representative.
Little piece of news. The condominium with 500 people in Freedom, both sides of it want the condominium dispute board at this point, and they would be here talking, except I told them interim
Yep.
study doesn't mean anything.
Yeah, yeah, and I would just, to end this, I would just say that there are some bad actors in condo. Your association ones well, others don't, where they're bad actors and they need something like this. So
I'd just like to add for that one that both sides of the freedom argument have a point.
Okay, that's good to know.
I hope that you're going to listen to them carefully when we put in a bill to try to thread the needle, and they'll each of them be upset a bit.
Absolutely. Thank you so much. Okay, we will end the hearing. I don't have the gavel, so.